just go through the official notification process. You're hereby summoned to attend the monthly meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber at Guildhall, Derry on Thursday the 13th of November 2025 at 4 p.m. It's just in terms of attendance, so Alderman McMorris.
Here, Karen.
Alderman Montgomery has sent apologies. Alderman Wilkinson. Councillor Lillian Bauer. Councillor Raymond Bauer. Councillor Paul Boggs. Councillor Clark.
And Shaw.
Councillor Deeney. Councillor Devine. Councillor Duffy.
Shaw.
Councillor Hutton.
And Shaw.
Councillor McDade.
Here.
Councillor O'Farrell. And Councillor Taney. Okay, thank you, members.
Thank you, Karen, and I'll just read the broadcasting statement. I would like to remind everyone physically present at this meeting or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of this broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council's privacy notice may be found on the Council's website. So, members, we will look at item 4, declarations of members' interests. We can deal with that now, or if you want to do it as we go along throughout the meeting, it's completely up to yourselves. Do it as we go along. Thank you. So, agenda item 5, we have a deputation here today in the chamber, and I would like to welcome representatives from the Western Health and Social Care Trust here today, who will be updating us on emergency general surgery and the development of a vision plan for Fermanagh and West Tyrone health and care futures. So very welcome to Mr. Neil Guckian, Dr. Brendan Lavery, Mr. Mark Gillespie, Mrs. Teresa Malloy, Mr. Shane Breen and Mr. Chris Kern. So you're all very welcome here today in the chamber, and whenever you are ready you can just go ahead with the presentation and we will take some questions and answers from the members afterwards. Thank you.
Okay, thank you, Chair, and I propose to just make a short statement at the start and then I will hand over to Brendan. So thank you for the invite to Derry Strabane District Council and the opportunity to speak to you today, and we're delighted to be here. It's my role, just to explain my role in health and social care. I'm the accounting officer and chief executive of the Western Trust. It's my role to provide safe services and to improve population health and reduce, where possible, health inequalities. Given the Northern Ireland demographic changes, reform to health and social care services is inevitable. But we will outline the significant progress we have made regarding general surgery in particular, and to outline our next steps to develop a vision for Fermanagh and West Tyrone as a people and place, with SWA, Southwest Acute Hospital, integral to that work. We recognise that this change has been difficult for some people in Fermanagh, but a lot of the concerns are linked to false information. Today, we can address that. In our presentation, you will hear that our changes have transformed outcomes in terms of mortality, readmission rates, and other complications for general surgery for all the population of the Western area. Such improvements are vital if we are to address the significant disparity in health status between our northern and southern sectors. We have transformed our medical workforce, now having more general surgeons than ever before, with no reliance on agency and locum. The number of patients impacted are small, with the majority staying in Southwest Acute Hospital through ambulatory services. Our new service currently meets all of Minister Swan's standards for the first time, and we are responsible for the outcomes of patients and clients, and Brendan will outline how we assure ourselves in relation to that. We acknowledge as an organisation, and I acknowledge as Chief Executive, that flow through our emergency departments is challenging. The issues around that are complex, but are primarily outside of the emergency department and indeed our hospitals. Capacity in residential and nursing care places is the biggest constraint, and this has been made worse by our population growth. I pay tribute to everyone working in our pathways. It is their compassion and dedication that has given us the improved outcomes. So today in our presentation, we will be covering, first of all, an update on emergency general surgery, the operational improvements, assurance on patient safety, our transfers, our emergency department activity, and the current position in relation to the RQIA review. Then we will move on to the work that we're doing in relation to a vision for Fermanagh and West Tyrone, the visioning based on a foundation of understanding of health and care need in Fermanagh and West Tyrone, and how the South West Acute Hospital will meet the health needs of its current and future population, and then building on the findings from the Pathfinder public engagements that we carried out in previous years. I will then talk about cross-border collaboration, and we will conclude obviously with questions and answers. So to start off then, I will hand over to Brendan to give us a little bit of a high-level conversation.
Okay, so I'm going to start off with really a description of general surgery. Now, general surgery, it's a wide-ranging specialty that focuses on diseases of the digestive system. Over the years, this has become more subspecialised, and for example, we now have colorectal surgery and upper and lower GI surgery. Emergency general surgery relates to the treatment of patients who have acute abdominal pain, infections, bleeding and trauma. Now, more importantly, what isn't general surgery? There's no involvement of any kind of a general surgeon in a caesarean section where a child is delivered. That procedure is under the sole remit of an obstetrics and gynecology consultant who are specialist surgeons in their own area. Also, general surgery has no place in the management of fractures. This is the remit of trauma and orthopaedic surgeons. The ministerial document, Review of General Surgery in Northern Ireland, set out 6 safety standards for patients to have the best clinical outcomes. As Neil has mentioned, we now fully comply with all of the EGS safety standards which were published in 2022. Altnagelvin has a new interventional radiology area with additional consultant recruitment in the specialist practice. We have also in the last 6 months set up a medical-led upper GI bleeding rota, which is available on a 24/7 basis for all patients within the Western Trust. Many general surgeons have specialised their practice in order to concentrate on treating particular conditions, for example, breast and other types of surgery. While this does lead to improved outcomes for patients, it has also created difficulty in having appropriately trained available surgeons for the treatment and management of emergencies. Changes to surgical training have led to newly appointed consultants having less exposure to the generality of surgery. And for example, no newly trained surgeon will have the expertise required to treat patients with upper GI bleeding. The temporary cessation of emergency general surgery in SWA has consolidated our acute surgical team in one site and allowed the Trust to make a large number of improvements to benefit every surgical patient across the Western Trust. We now have no locums at consultant level in general surgery. This improves patient handover, ensures continuity of care, and gives us better treatment for all of our patients. Finally, we need to look at the regional context. It was recognised in EGS safety standards that South West Acute, along with Daisy Hill and Causeway Hospital, would, quote, require more fundamental changes in a number of areas to meet the standards. Daisy Hill has now had emergency general surgery removed on a permanent basis, and the consultation in Causeway has concluded, and we are awaiting a formal ministerial decision. Thank you.
Okay, if I can just take you to the next slide then, please. So in relation to SWA emergency general surgery and the operational improvements, but also just focusing down in terms of the impact of transfers to Altnagelvin. As you can imagine, in preparation for the temporary change in December 2022, we did a detailed analysis of surgical patients that had previously attended the emergency department and were admitted to South West Acute Hospital. On the basis of that data, we initially identified that 5 patients would be required to be admitted. From December 2022 to June 2025, 2,338 patients have been admitted to Altnagelvin who may previously have been admitted to SWA surgical ward in Southwest Acute Hospital. This equates to 2.5 patients per day, which is different from the 5 that we initially had planned for. And I'll come back to that when I talk about ambulatory care and patients continuing to have their care close to home, which is ideally what all of us want for the patients and the population that we serve. You'll see there from the data set that just really sets out the emergency department attendances. And even with Southwest Acute not admitting patients for emergency general surgery, their attendances have continued to grow year on year. Next slide, please. So operational improvements and impacts of transfers to Altnagalvin. Obviously, in planning for the change, the patient experience and the patient journey was very much at the foundations of the plans, given the distance that patients might have to travel, was very much at the forefront of our planning. However, we did find challenges in the early part of the temporary change, and from December 2022 to April 2024, 26% of patients transferred from Southwest Acute Hospital went directly to a bed. That was below the requirement that we had set ourselves from a trust perspective. So in June 2024, we reset our systems. And since then, we've seen significant improvements with respect to that particular aspect of care. 79% of patients transferred from Southwest Acute directly to an inpatient bed in Altnagalvin with a number of weeks where we've achieved 100%. And that's from May 2024 up until June 2025. From the 7th of May 2025 up until September of this year, this figure has increased to 92 patients going directly to a bed. When we look at how many patients don't go directly to a bed, this equates to 2 patients per week who do not go directly to a bed. So the numbers are small. And I think it's entirely appropriate for me to point out that it also is entirely appropriate for some of those patients to stop an ED for further assessment or for further diagnostic imaging before they are transferred onto a ward. It's also really important to note that it is the clinical decision of the consultant which patient is allocated to a bed in terms of priority. So it is about clinical decision making, and it's about the outcomes for the patient and who is most in need. But just to go back on that point, it is a very small number of patients on a weekly basis who do not go directly to a bed based on the changes that we made to our operational planning from May 2024. If I can then take you back just on the next slide, please, to ambulatory surgical care. In preparation for the temporary change, we were very mindful that we wanted to ensure that where possible, patients could have their care close to home. And with that in mind, surgical ambulatory services in Southwest Acute Hospital. This allowed those patients who were previously admitted to Southwest Acute and who stayed less than 24 hours to have that care in Southwest Acute Hospital under the care of a surgical doctor, where we have excellent access to diagnostic services. This service offers direct also access to GPs for direct advice to a senior doctor, same-day assessment for an ED doctor for surgical patients, and also for GPs. And GPs can also use it directly for telephone advice. Evidence suggests from our Royal Colleges that this is a safe and effective method of moving care forward. And the fact is our patients like it, because in the majority of cases where possible, our patients want to be managed on an outpatient type basis. They don't want to be admitted. Just from an Altnagalvin perspective as well, when patients stay less than 24 hours and they can be managed by a different pathway, that gives you a better approach to managing the capacity that you have and in terms of being efficient. So not only was it developed in Southwest Acute at that point in time, it was also implemented in Altnagalvin, and that meant that not every patient who historically was admitted needed to be admitted as well, so it gave us greater efficiency. As you can see from the data that we've shared, from December when we initially set out to March 2023, that was 2.6 patients. And as you can see from the 1st of April 2025 up until the 7th of May, that has increased to 4.7 patients. And in actual fact, the data that you can see is our figures from the 1st of May to the 31st of October, which is 5.7 patients. So we are steadily seeing an increase in ambulatory care services growing in Southwest Acute Hospital, which allows our patients to have care closer to home and avoid the need for travel. Brendan? Okay. Thank you. So next slide, please. So, no problem.
So firstly, I'd like to go slightly backwards just to clarify the number of surgical patients transferred from SWA ED to Alton and Gelvin ED. This is 2 patients per week. Alton Gelvin ED is under continued pressure, like all emergency departments across Northern Ireland, including South West Acute Hospital and indeed the UK. However, any statement that says that Alton Gelvin ED overcrowding is due to surgical patient transfers from SWA is incorrect. The vast majority of patients that wait in our emergency departments are patients who require medical admission. It isn't surgical patients, it's always medical patients. That's the vast majority. Unfortunately, they are waiting for beds. I'd like to share some positive patient outcomes that have come from an independent organisation, CHKS. Specifically, we have lower death rates, lower numbers of surgical complications, and also lower numbers of readmissions of patients. All of the information that we're presenting is based on the independent analysis provided from CHKS. This provides healthcare data to 70% of the acute healthcare providers in the UK. It's actually the data that it provides, it is included in a mandatory section for all of Northern Ireland Trust's annual quality reports to ensure ongoing monitoring of patient outcome and to ensure that we continually review patient safety. Risk-adjusted mortality measures are used to help hospital providers look at the number of deaths that occur in a hospital and compare these with the number that would be predicted. This is calculated using data from the past 5 years from every single patient admitted in England, Wales and Northern Ireland. 100% of hospital deaths are used and there are no exclusions. To give you some context around the score, if we just go on to the next slide. A value of 100 means that the number of deaths is exactly what you would expect. And they make this calculation based on how a patient presents, what illness they have, and also if they've got any underlying illness. A value of over 100 means there are more deaths than would be expected, and less than 100 means less deaths than predicted. Now, as you can see, the combined mortality figures for the Western Trust patients, that is on the Alton Gelvin and the SWA site, from January 2020 to November 2022, scored 98.75. Since we have consolidated the service onto one site, we have almost 2 years of data, and the mortality index has decreased to 84.98. This is a significant number of patients and a significant number of lives saved. We have a decrease in mortality of 13.94%. Now, the reason this has happened is because we now have full compliance. We've worked with the safety standards, we've put a huge amount of effort into making sure that all patients in the Western Trust get the best possible treatment that they can. Next slide, please. The next 2 figures again show that we have had a decrease in complication rates of 20.7% and also a decrease in readmission rates of 21.9%. All of these are both direct and indirect measures of patient safety and patient outcomes. Thank you.
Chair, I know that Council have endorsed the roadmap from Save Our Acute Services. We will outline at a high level our position on it. We hope to meet the group next week to go through their recommendations with them. We owe them that courtesy, and therefore we will speak at a high level in relation to their roadmap tonight. The roadmap, we would divide the recommendations in the roadmap into 3 areas that we would agree with and support, areas which we will need further work and which require other bodies or partners to lead, such as commissioners in the Department of Health. And there are areas where we will factually challenge and cannot support, particularly from a patient safety concern. So we cannot support every recommendation. As I say, we have an engagement meeting arranged for next Friday, and we are very much looking forward to that meeting. In relation to the recommendation in the roadmap for cross-border cooperation, I do want to place a couple of things on the record, Chair. There's been some discussion recently regarding this and the need for cross-border cooperation in health and social care. I can assure Council that the Western Trust is at the forefront of cross-border cooperation, with more services jointly commissioned in our Trust than the rest of Northern Ireland together. We remain totally committed to this, and we are hopeful of further developments in the coming months. in my role as outgoing Director General of Cooperating and Working Together on behalf of both jurisdictions, which is the oversight body for cross-border health and social care cooperation, I have received the support of all partners north and south for 2 developments. First, a scoping exercise for the commissioning of further cross-border acute services cooperation to identify further opportunities for cooperation, and this will be coordinated by COT partners and the COT Development Centre. Second, COT are supporting engagement between the 2 ambulance services to identify any perceived or real barriers post-Brexit to cross-border ambulance conveyance to support border communities, particularly from the side of the north. And third, locally, the Western Trust are working with colleagues in the Sealshire Group, which covers from Galway up to Donegal, and HSE, with the aim of identifying where we can further support each other and border communities to improve access. Chair, thank you. I will now hand over to Teresa.
Thank you, Chair. Just move the slide on, please, and just go on to the first slide in this section, please. Thank you. Chair can confirm that the Western Trust took decisions at its Trust Board meeting on the 7th of October to design and develop a vision plan, which would include specific work on SWA and which will be people and place-based, focused on health and care needs in Fermanagh and West Tyrone. That means that we will seek to prepare a vision which spans hospital care, social care, community care and primary care in the work that we wish to do in the time ahead. Our intent in this work will be to listen carefully to people's needs and aspirations, look again carefully at the data, and to align our approach with meeting the population health and care needs of Fermanagh and West Tyrone. So, Chair, I'm happy to confirm that this work has the highest possible support from within the Trust, and that the Board were unanimous that we should undertake it before we would relaunch any future consultation or the future consultation work on emergency general surgery trust-wide. So, Chair, I'm happy just to spend a little bit of time stepping through the proposed approach in the following slide. So just move to the next slide, please. In considering our work on the vision, we've agreed an initial set of work streams, and they're set out in the diagram. We'd like to provide, and in fact, today's session we hope is part of this, we'd like to provide a great deal more information on the services we provide in Fermanagh and West Tyrone to our population. And we also feel it's important that we place much more information in the public domain about the emergency general surgery service that patients receive, both those who attend ED at SWA and use our ambulatory care service, and those who do need to travel to be an inpatient for emergency general surgery at Altnagelvin. We obviously and sincerely want to engage with external stakeholders to provide information, but more importantly, to listen to them, their concerns and answer their questions. It is most important that we engage with staff, new ways to do that formally, and have undertaken informal meetings with staff to listen to their views. We are starting our work on what process and expertise we should use to work with people within and outside our organisation on the vision. This will come together in an agreed way to undertake the work. We hope that that will be very well informed, and we'll take great care to make sure it has support with staff and with external stakeholders, importantly. Once we've done this initial work in the first 3 boxes, we will assess whether we feel confident and ready to move into an agreed process to undertake the visioning work before we launch that work. And we, as the diagram indicates, will have a small team to help us with the work, and we will be supported with advice from experts. And 2 of the people who are helping us with the work are here at the Council today, Shane and Chris. Next slide, please. We've considered some dependencies, and we're building those into our thinking. Obviously, we need to understand very well the pattern of population health and care need in the Fermanagh and West Tyrone area and the expressed need, which we heard during our Pathfinder process. The importance of how we might bring primary and community care more fully into this work. Any research that we should bring to bear, and there is rich information available and examples that we have used from within the Nuffield Trust. We are already involved and being engaged with in the development of a new model of care for Northern Ireland, the neighbourhood model, and that policy work may be helpful and actually quite impactful in the vision work ahead. And of course, we are considering carefully how we enhance public engagement and involvement in the visioning work, and we want to ensure that that is designed into our process. Given all of this, we'll take a staged approach to the visioning work, which has strong governance and milestones to check our progress. Next slide, please. All such work should have a good foundation in evidence. You've heard other evidence today, and of course there are many sources of population health evidence. I've listed some of them in the slides. Some of them are in the public domain, such as the Health Inequalities Report 2025. I'm sure members of this council would have seen that, considering the messages for this council area. The Pathfinder report is in the public domain, as you know, and perhaps just to very quickly summarise the key messages and conclusions of that report. The Pathfinder report listed a number of issues and concerns from the population of Fermanagh and West Tyrone, which included uncoordinated care for a growing ageing population and for those who have to travel longer distances for their care. Concerns in longer waiting times and ensuring equity across the Trust and across Northern Ireland for elective or planned care. The difficulty and concerns about attracting and retaining healthcare workers and the risk, therefore, of unplanned changes to services. And the importance of enabling older people to live independently in their own homes. And the report also indicated an increasing level of concern about the stability of primary care in the Fermanagh and West Tyrone area. And those were all important and strong messages from the Pathfinder work. We have also done work internally within the Trust. We have our own Population Health West report. It's very regularly reviewed and our board has access to it. And then finally, the Public Health Agency, of course, facilitate the local AIPB and have done some important work on population health and indicators of health. And I'll just dip into those today, not in any detail, but just to give you a picture of what we're seeing. So if we move on, please, to the next slide. This is a single slide, I think, with one of the most important graphics in the Health Inequalities Report. It indicates across Northern Ireland in each council area whether population health is better than, similar to, or worse than the rest of Northern Ireland or the average of Northern Ireland. You can very clearly see in your own council area the position, which is extremely concerning, and you can see the Fermanagh and Omagh district area. There are also deprivation indices and multiple deprivation indices. Those are available in the public domain, and they would indicate that there are very significant areas of multiple deprivation in this council area, and I'm sure you're aware of that, and we'll see some more of that in the later slides. And it also indicates the very significant levels of access deprivation in some areas of the Fermanagh and Omagh council area. Next slide, please. Just then to give you a little bit of insight into some work done by the Public Health Agency to support discussions for the Western Area Integrated Partnership Board. They looked with us or provided information to us across 9 indicators You can see those on the slide. The slide's available to you, I assume, after today's meeting, so people can look at it more carefully. Just to clarify, CHD is chronic heart disease, just in case people are not sure about the short form. But essentially, the Public Health Agency indicated selected a small number of health indicators, health and wellbeing indicators, actually, to look at per DEA. And they coded them in a kind of a heat map, so that they used a traffic light approach, with dark red being something you don't want to see, and dark green being something you do want to see, and gave them a rank. And if we just dip into the next two slides, just to give you really a picture of that. So the first slide is for Mana and Oma, and you can see that the areas of concerns in terms of DEAs are those that have the most red, and that is Enniskillen and Oma. And you see, and if you look down the disease types, you will see that dementia patients, that prevalence across the council area would be of concern. So you can look at that, the information in both of those ways. And for completeness, and because we're at council today, I thought it was important again to provide information for this council area. You can certainly see a great deal more red, and a much more concerning picture, I'm sure, for this council. I'll just finish with the final slide saying, of course, we all understand that population health, and there's a great deal of research on this, including by the King's Fund that's presented, is not just about your health service and your health and care services. It's about the causes of poor health, and as you can see, deprivation and poverty are strong features in this council area, and in poor outcomes for our population. I hope that's not been too long, Chair, and has provided some insight to the foundation work that we are doing within the Trust as we begin our work on the visioning process. Thank you.
Thank you, Chair.
Thank you all very much for that very detailed, informative report. So I'm going to open the questions now to the floor, and the first indicated speaker is Councillor Devine. Go ahead, Caroline.
Thank you, Chair. And thank you very much for coming and presenting to us today. That was really informative. I actually welcome the data that you've presented. I'm a data person, so it is good to see the figures there in front of us. And particularly, I suppose it's really important when we see the improvements in mortality, in readmission, and the reduction in complications. And I think sometimes, that's what we need to see. We need to see the figures and see what improvements or what changes have come about as a result of changes. I suppose one of the first things I think that strikes me, just a general comment, I think the gap in communication, I think, has led to a vacuum that's maybe created mistrust, and I suppose speculation amongst the public. And I suppose that's maybe something that I would reflect, and maybe that you might take on board. I have a question around travel time. So you'll be aware that SOAS has come and presented to us, and I'm a rural councillor. And I suppose that concerns me as well in terms of travel time and how long it takes for patients to get to hospital. So I'd like to know, just around travel time, are there safety standards? If you could comment on that.
No, there are no. So, for example, there are isolated populations all across the UK. If you look at Cumbria, if you look at the area south of Edinburgh, there are lots and lots of areas that are very geographically isolated. What we have here is being replicated across the rest of the UK. The problem is that some of our smaller hospitals are struggling to provide every service that they want to. Now, what a lot of people don't realise is when we had the temporary cessation of surgery in Southwest Acute, that wasn't a choice. We had no consultant surgeons left, 0, to provide the service. You can't have a service without consultant surgeons. If we had 1 or 2, We could potentially have backfilled with some temporary staff or with some locums, but when you have no staff, really your hands are tied. It's not a decision anymore.
And Caroline, what I would say as well is, I suppose there's a few things in what you've said. In terms of timescales, I've lived in Derry all my life. I know that if I go into Altnagavin Hospital, there is a chance that I will have to transfer to the tertiary services in Belfast. The reason why we all sign up to that is because we know that will give us the best chance of better outcomes. What we're saying here is we have reviewed every patient outcome, an adverse outcome, and we can assure this council that patients have not come to harm as a result of this change, but as a result of the additional travel time to Altnagavin Hospital. And I think if in a scenario where we know there's better outcomes and we know that patients haven't come to harm, well, then it has been a successful implementation of a change. And it's in the patients, all the patients of the Western Trust's interests to improve their outcomes across the board. I suppose what I do have to say as well is there's a difference between patient experience and patient outcomes. We all don't like an adverse experience. And every month, I apologise to the population of the West for the experience that they go through bottlenecks in our emergency department, because it is not a good experience. We know that. There are complex reasons why it happens. But if you get a better outcome as a result at the end of that, I would ask that the population work with us. If I will sit through an uncomfortable journey through health and social care if I know I'm getting a better outcome at the end of it. If you get a bad experience and a bad outcome, well, then that's a situation where Brendan is advising me, then you need to change the service. To me, it's all around making sure we protect, make services safe and make the outcomes as good as possible. I would accept wholeheartedly about communication. However, it's extremely difficult, and I'm going to defend some of my staff at this point. It is extremely difficult in the modern age of social media, and when there's fake news constantly being projected into social media, it is extremely difficult for a public body to respond to that in a robust and honest way and a speedy way. So, but we are now determined. As of today, we are launching our information in relation to this today. This is our first engagement session, and for the next number of months, we will be engaging with all stakeholders and communicating, as you say, Caroline, and we welcome that feedback.
Councillor Devine, I was just going to say, go back to the point that I was making earlier on as well. We're very mindful of the travel time. We want patients to have care close to home where possible. Ambulatory care services are key and fundamental aspect of that. But just to reassure Council as well, we've undertaken quite detailed audits of every patient, clinical audit with the surgeons and with respect to patients who have been transferred. And as a result of that clinical audit, we've identified a number of pathways where some patients, again, who needed to travel to Derry for surgery are now being booked in for their surgery to Omagh or Enniskillen for an elective procedure, again, minimising that chance of having to travel. But also just to reassure where patients do have to travel, and when we consider mode of transport, all patients are seen and assessed by a senior doctor in advance of that decision in terms of that most appropriate mode. So safety is at the core of everything that we do from the point of view of transfer, and also minimising the likelihood of transfer as well.
Chair, I have a couple of other things, if that's all right. I also actually, Neil, you'd mentioned COT, and I know they do great work. I've actually worked for COT myself previously, so I know that cross-border work is really important. And I suppose I welcome that would be part of your visioning as well. I do want to say that, and again, I welcome the fact that you're talking about needs-based when you're looking at your visioning work. And I think it's really crucial that staff are engaged with on an ongoing, continuous basis for any work that's happening in the future, and also actually public engagement. And again, it comes back down to that communication and building trust and having people come along with you. And I suppose an open and a transparent process that everybody knows what's happening and everybody can see what's happening. I wanted to ask just as well, so we've a letter from the Health Minister has been shared with us in relation to the SWA remaining an acute hospital. And I just want to know what are the implications of that. So obviously that's not linked into having emergency general surgery. And just my final point is, so obviously you'd mentioned the recommendations coming down, and I suppose, is there anything you can say in terms of the safety standards in relation to some of those recommendations? I know you're having a meeting and I know you're mindful of not going into that in detail, but is there anything you can say around those at the minute? I think that's everything, Chair. Thank you.
Okay, just to answer your last question first, we can confirm that we are adhering to all the standards of emergency general surgery in our service, in our network service. Remember, we're not delivering emergency general surgery surgery within the Southwest Acute Hospital at the moment, and it's temporarily transferred to Atnagalvin. We have the ambulatory service there, so across the network of hospitals in the Western area, we are adhering to the standard, Minister Swan's standards in all areas, and we believe we're the first hospitals across, outside Belfast, who are able to adhere to every single one of the standards. So, and that has underpinned our improved outcomes. That's the first thing. And second, next, in terms of our needs-based approach, absolutely. But needs change. And I think what Northern Ireland has been poor at is having our public services change to meet the changing needs of our population. So that is something that's going to challenge all of us over the next decades. How do we bring everyone with us to bring change, significant change? This is 2 patients a day. This is small beer in comparison to the 10 million interventions that the Western Trust deliver every year. 10 million interventions a year. And this is 2 patients a day. In fact, you could say it's 2 patients a week in terms of the GED journeys. 2 patients a week against 10 million interventions. And yet we are diverting a lot of our management time, a lot of our energies towards this change. That's just the very tip of an iceberg in terms of the changes that will have to happen to health and social care in the coming decades. And the public and public representatives will have choices. You know, it's all about choice. We are public service. This is all around the choice for the public of Northern Ireland. And if we insist on not changing, well, then we will not meet anybody's needs. So it's important that we maximise the number of needs that we meet. And yes, we will be open and transparent, I can assure you, as a public body, and there will be public engagement. There has been no better engagement than the Pathfinder exercise that we did a number of years ago. 2,200 of our population in that area actually sat down in a structured way and told us what they personally wanted and needed in health and social care. And we brought it all together in a report. It's interesting that one of the top things that they said was primary care. Look, fast forward 7 years, primary care is in a difficult place. However, we have stepped in the southern sector, and we're now managing 3 practices ourselves and delivering services, over 30,000 patients.
2 practices in the north.
And two practices currently in this city. So we recognise it, and we will step in. We're the only trust to have 5 practices, GP practices. We're not a primary care trust, and yet we're delivering that because we recognise the need of primary care services as well. And COT, I absolutely endorse with you. I just love COT. I think it's a fantastic. But the Ballyconnell International Agreement was a brilliant partnership agreement. So thank you.
Thanks very much for that, Councillor Devine. And if members don't mind, Alderman McMorris has to leave for some of her deputy mayor duties, so I'm going to bring her on next just to give her the chance to speak. Thank you.
Thank you for letting me in early, and apologies, I do have to leave, but I want to thank you for coming along today. Do you know, I think it's really beneficial that we are getting the stats and getting a clear indication of what actually is going on out there, because I do believe we need to hear both sides of every argument in order to get down to the nitty-gritty of what really is going on. And I really do appreciate your honesty, Neil, today, and bringing everybody forward for that honesty. You talked a wee bit there about the ED experience, and I was just looking to ask, I know the Minister had brought out there recently about the business case for the ED department, and I know that's back sitting with yourselves. And as you know, and as you rightly said, you know, there's a lot of myths and whatever going out in social media at the time. You know, I seen this week where somebody was supposed to be lying outside a bathroom, and and I'm sure you're seeing that all the time, but where are we with the business case, Neil? Just do you know what I mean? Because I think that's one of the main things that would make a massive difference to the people in this city and district and further afield, even up as far as Fermanagh. But so just like a wee bit about that, and also about, you mentioned about the GP practices. That's what we get all the time about not being able to see GPs. So maybe just your comment on that. But I had mentioned the last time when the group had come in to present to yourselves with the roadmap and all. I know that there's like private surgeries going on up in SWA in regards to, and I welcome it. Do you know what I mean? I welcome the fact that, you know, people are getting knee replacements up there and the waiting list is coming down, because as you know, that's one of the areas that's always hit first whenever there's budget cuts or whatever. But is that a continued thing that you are going to be doing in order to bring down waiting lists, Neil, or what's the plan in regards to that? But yeah, and just one last point, I just want to say congratulations on meeting all your standards. I mean, in the climate that you are working under, do you know what I mean? And I have to say my own personal experience with any dealings that I've had with regarding staffing, from the level of your PA right down to the cleaners, has been exceptional. They're working under serious, difficult circumstances. Do you know what I mean? So I do want to leave with a positive, Neil,
Thank you.
that the staff is exceptional.
I'll pass it back. Thank you very much for that. Okay, there's three things covered. You know, anybody who, if I have a theatre that has not been used, anybody comes to me, they're pushing out an open door, is the first thing I will say. I would highlight that this isn't about the private sector coming in and doing private sector work. This is about the health service commissioning the private sector to increase the capacity within the health service. You know, yes, they're a private organisation, you know, but I just want to emphasise there's a slight nuance difference there. You know, it isn't just us opening a private wing of a hospital. It's us commissioning on behalf of the region, not just in terms of the Western Trust. That's the first thing. The second thing is GP, you know, primary care. I want to emphasise I am not responsible for primary care. I want to limit my responsibility here. I have extremely wide responsibility in this area, but primary care is not my responsibility, with the exception of the 5 practices that we've taken over, and we're supposed to be the provider of last resort, Chair. Sometimes it doesn't always feel that way, but we are delighted to do it, to make sure that the patients continue to get the service that they certainly need. But hopefully you're not getting too many complaints about our practices.
No, I'm basically reiterating that because I believe that has a real knock-on effect on the difficulties user experience.
Yes.
So I know you're not responsible, and I really appreciate the fact that you're taking on 5 surgeries, but it's more about the knock-on effect that it has within your own services.
The final comment in terms of ED, you know, I would emphasise that as we sit here today, the emergency department business capital, the capital for the business case for the emergency department in Altnagavin is not included in any capital programme. We need to, you know, there's all sorts of noise going around. As we sit today, there's no money set aside for that programme. It's not included. We were asked to take, the reason why there's some hold up in a business case is because we've been asked to resubmit a different business case, a smaller business case just for the emergency department. And we accept that as a priority, so therefore we agreed to do that work. So we are preparing, the business case for tens of millions of pounds is a complex exercise. We are fast tracking it, and it will be on the deadlines that we've been set. So, but I just want to emphasise that doesn't mean that we have a new ED commissioned for Altnagavin Hospital. And I know this council has been extremely supportive of my organisation in regard to that, Chair, and we want to thank you for that. And I know elected representatives across the board have been really, really supportive of that. And I can assure you, I will continue to lobby for that. We have put it as our top priority in our revised capital programme for the next 10 years. We've put it as our #1 priority. And quite frankly, I accept as I say, every month I apologise for the experience of our patients. And it's just not acceptable. It's the oldest ED in the province by some considerable time, I'm told. And Teresa just wants to add one wee point.
So obviously it's a very, very challenging environment in Altnagavin Emergency Department. And emergency departments generally are not places that were designed for people to stay 12, 24, 48 and potentially more hours in them. So we have agreed internally within the trust that we will do some improvement works within the ED, and we hope that everybody will bear with us because it's changing the plane while you're flying it. It will be to add toilets, add showers, add a kitchen, because we have to safely provide nourishment to patients who are in our ED. So some of those basic things will cost quite a lot of money to mobilise and to ensure that they are there by the end of this year. But we have embarked on the scheme to do that work.
Thanks very much for that, Teresa. And the next indicated speaker is Councillor Boggs. Go ahead, Paul.
Gurmagut, Ciara, and thank you very much to all of you for coming today. And can I just re-echo as well what others have said around the good communication that comes particularly from your office, Neil, whenever we are raising issues, and what Alderman Middleton says from your secretary, who I'd say hates to see your email addresses popping up in the inbox, but never makes you feel as if you are bothering the trust by raising issues on behalf of constituents that come our way. I suppose from the outset, just to provide some clarity as well, we have endorsed the roadmap of SOAS as a council. Last month, I made the remarks when SOAS were in front of us that we were content to do that as a party group, first of all individually, on the basis that we still wanted to engage with the trust at this level, and we are really, really grateful that you have come in such good numbers to provide so much information to us in the first instance. But I just want to make that point as well. We are not clinicians. We have never claimed to be. It's the same when we have the department on here. While I'm a qualified teacher, I'm not teaching anymore, so I don't, class myself that I have the knowledge to make the decisions on the ground here and now. When we're talking about roads, we're not roads engineers, and we don't treat you any differently. So we do welcome the opportunity to engage with yourselves. I suppose just Caroline has picked up on a number of the points that I wanted to raise as well. But I do want to go back to the communication piece that Caroline talked about. It's been talked, it was mentioned, and I'm not saying that it was done in any way to omit the people of West Tyrone, but it was a direct quote that it's difficult for the people in Fermanagh. It's difficult for the people that Caroline and I represent in rural West Tyrone and the Sperrin DA and in the Derg DA. So it's not a Fermanagh, it impacts Fermanagh, but it's not a Fermanagh-centric issue. It spills out over, and I think you acknowledge that and respect that, but I just want to make the point that it fits under the communication piece, and that let's not talk about one when it impacts on a greater area. So that's the first thing. And I just think in relation to some of what Neil picked up on in relation to the nuance differences around, private care being or private operators being used as part of the wider social care piece to try and drive down waiting lists, while we still see reports, and I know that SOAS did make reference to the fact that there are a number of empty theatres or a number of empty beds and SWA that aren't being used and all the rest. It's that communication piece with us as elected representatives, but also with the general public, who also aren't, the vast majority of them, aren't clinicians. And when there is a headline or there are a group of people, rightly or wrongly, who are claiming about the empty beds and all the rest, your general Joe Blogs out in the public doesn't understand why those beds are empty and why they can't be used. And I know that you have enough to be getting on with without having to create what did you call that yellow and black book at school? There was every topic for dummies, and I'm not even sure that's politically correct to say, but it's a brand of books that are out there. I'm not suggesting that you need to do that, but a bit more information, hopefully today is the start of something different in relation to this issue. A bit more information would go a long way. It is good to see the data and the statistics around patient outcomes improving. But what I would just look a bit more clarity on is, does the vision in itself, so the vision that was set down by the Minister for you to work under, and I understand that you work at the direction of a Minister, in your opinion, are we missing the opportunity to seize the positives of increased cross-border working, particularly when it comes to emergency general surgery? I know of the good work that you've talked about, Neil, in relation to the good cross-border work that we are doing. Maybe we outperform other trusts because of where we are geographically on the island, which is fair enough. That doesn't undermine the good work that is happening. But does this vision exercise tunnel our vision about the future cross-border working that we could be doing, and I'm asking specifically in relation to EGS, and we are at a point in time now, and somebody mentioned the fact that things change very quickly. If something changed in the time ahead that created the space for emergency general surgery to return to the SWA, does the Trust prepare for that as well? Is that something the department are open to, even though this is what we are planning for and putting into practice at the minute? And that ties in again to the spare beds and theatres piece, that cross-border piece around can those beds and the staff to provide those beds to open be found on a cross-border rather than just looking at a trust piece. Again, I'm not asking that you haven't given the information. I'm just looking for a bit more clarity around it. Finally, then, I think for me is just in relation to the safety piece that you have touched on, and I think everybody can agree, whether you're a clinician or you're an elected rep sitting here, the safety of everybody, whether it's us as individuals, accessing service. If I had to go to an emergency department tonight or worse and looking for emergency general surgery, I want to know that I'm getting the best care for myself, let alone constituents that we represent. We're all human in that regard. But can you provide for us a bit more information? And I'm not asking you to drill down, and I think Caroline touched on it, but I don't think it was fully answered. Can you drill down at the minute for us where you maybe see something that is glaringly obvious within SOAS's recommendations that would compromise on the safety of patients? And I'm maybe looking at Brendan because I think you had touched on it slightly, but can you highlight for us where safety would be compromised in either the areas of the recommendations that you've talked about or specific recommendations themselves? So I think I've covered everything, Chair, for the time being. Garmugget.
Okay, Paul, and thank you for your comments and question. The first term, in relation to cross-border, I'm specifically talking about emergency general surgery. There are two aspects of cooperation across border at a very high level. There's emergency access and there's elective access. Emergency access is what I've commissioned in relation to the ambulance service, making sure that a member of the population of West Tyrone, West Fermanagh, whatever, will get access to the closest hospital. That's a key mitigation that we've been aspiring to get to. There are currently, since Brexit, there are barriers to that in terms of ambulances crossing the border from the north to the south. I have commissioned, and with the support of the colleagues, not just me, COT will investigate that in the coming months to identify the barriers perceived and actual to overcome those, so that both governments then can overcome those, and so that patients then can be conveyed to the closest hospital. And it's going to be very small numbers, Paul, just to reassure you, because you've already seen the very small numbers impacted by emergency general surgery in South West Acute Hospital. This is a subset of a subset. A small populations close to the border, but all the same, if they can get to a closer hospital, it's entirely, it should be our work to ensure that happens. In terms of elective, I have to say, I've done a lot of work with cross-border. It's very, very clear that the elective situation north and south is completely different. We have extremely long waiting lists for elective interventions, whereas in the south, there's shorter waiting lists. Secondly, you've probably heard the announcements. There have been major announcements of major investment in terms of Sligo and Letterkenny, and that's particularly relevant for elective services. So we have to be realistic in terms of the work that we do cross-border. We will be working to maximise the cooperation, but we have met, the management team of the Western Trust and the management team of Saoirse have met recently to ensure we maximise the cooperation on the cross-border. To best of my knowledge, that's the first time that's happened in many, many years. We're really focusing on this to maximise the cross-border benefit. In relation to the beds, and the empty beds and empty theatres, can I just explain there's a difference between things that are put in a business case than a hospital that is actually operational. There isn't a situation where there's 92 empty beds in South West Acute Hospital. We will give you a full briefing on this after. We could spend hours talking to you about the empty beds, and the empty beds don't exist. We are over our beds, our commissioned beds in South West Acute Hospital. Same way as we are in Altnagovan. If you go in, there'll be beds in most corridors and wards. So there's no phantom beds in South West Acute Hospital. There was commissioned So there was a business case for additional theatres, and they were built in South West Acute Hospital. And it's my understanding, way before my time, that these theatres were designed for spare capacity for Northern Ireland rather than for the Western area. This is in case there's a contingency for additional. They've never been commissioned. I'm a provider of health and social care services. I don't commission and plan those services. So it'll be up, and when I talk about for other bodies, some of the recommendations are for other bodies. It's for other bodies to come to me and pay me to deliver those services. You know, yes, we will have to rejig the hospital to get extra beds and all the rest. But just to reassure you, I'm not sitting with patients in a corridor in South West Acute Hospital with empty beds elsewhere in the hospital. And that's what's being purported in the media. And I think that's unfair on my staff and unfair on the people really working hard in South West Acute Hospital. To go back as well about the status of South West Acute Hospital, it remains an acute, I don't think we've answered that, sorry. It remains an acute hospital. It has a type 1 ED service. It's consultant-led service. You know, so it's open for business, and it is delivering the services that their local population need. And I take my hat off to them. They deliver excellent services day and daily. In terms of, I think that's most of the things you're mentioning. We'll drill down. Over the next period, we will be drilling down more and more into analysis. Don't worry, we'll be giving you more information as the weeks ahead.
Just Chair, anything briefly in relation to the specifics of SOAS's recommendations and safety on patient care was the other thing that Councillor Devine had touched on, and I had asked it.
But be clear, we had to remove emergency general surgery because it wouldn't be safe, because we didn't have the consultants to deliver it. If we are to reinstate it, then we would have to be able to give people like yourselves assurances that the service was safe. So that's a major stumbling block as we sit at the moment. Otherwise, we would have reinstated it. So the standards are there. They're safety standards as much as service standards. And if so therefore that's Minister Swan's standards were there to actually declare whether the service was safe or not.
Thank you. Sorry, Councillor Boggs, just to add, it's not just about the surgeons. As Neil has mentioned, it's about the safety standards. They are there for a reason, and that's why our outcomes are better. So the problem we would have is we have no on-site renal medicine in South West Acute. We'd have to bring that down there. That'd be difficult. We have no interventional radiology. Again, that would be very difficult. So there are lots of reasons. It's not just about the surgeons. And I think the fact that we have such, and I'm going to be honest, such good outcomes here whenever we have been forced to consolidate on one site, that is a positive.
Thanks very much. And the next indicated speaker is Councillor McDade. Go ahead, Catherine.
Thank you, Chair, and thank you to everybody for coming in. I have a few points just that I've picked up from the presentation from all of you. But one thing I just wanted to pick up on was something that you said, Neil, there. I can't even remember who it was in response to now, but it was, you said about how much time and effort from a management perspective has been put into this one kind of part of this kind of change. I just wanted to comment that it's worth doing that. And I appreciate that we have lots of directors and assistant directors and the chief executive sitting here at 5 o'clock or whatever time you're going to be finished at, and you're going to do it now throughout. But I actually think that from a public perspective, from a staffing perspective, from a patient perspective, you need to invest it. And I know that it's a big part of your time, but actually it's worth it. So to say, I just think maybe just watch that, whenever you're saying, I think it's really, really important, and I appreciate that you're coming in. A&E or ED, I know that you had said, and I appreciate that it's not the surgical, and this presentation is around the general surgery. But I suppose what are you thinking along the lines of how are we improving the medical beds that are being blocked? Because everyone will have a story to tell you about, oh, my sister, my mommy, my brother, whoever has been lying in a bed or lying on the ground for 2 days, whatever. I suppose it's back to everyone's talking about communication, back to that communication piece again, because definitely whenever Save Our Acute Services came in, we've come in and given us the data, they came in and gave us and pulled at our heartstrings and told us the stories and told us that, and which one do people, the general public, remember? They remember the heartstrings. They don't really remember the data. So I suppose it's about getting that story out in a way that kind of resonates with people as well. I'm glad to hear that you're meeting with them, and I'm not going to push you on what you're going to be talking to them about and how you're going to kind of challenge those things that you do disagree with, because I suppose I'll just wait and wait for the feedback from that, because I do think that they deserve that respect because they've put a lot of work into what they've been doing as well and how they envisage the service. The work streams, Teresa, that you mentioned as well, I wanted to pick up specifically around the staff engagement and welfare box. I'm a wee bit cynical sometimes whenever I see that. Just to ensure, and can you give us assurances that whenever it's staff engagement, that it's all staff, it's not all doctors, it's not all senior nurses, it's not all senior clinicians, it's not senior management, it's staff from the porters and the cleaners and the admin, the nursing assistants, it's every single layer of staff, because from someone who worked in the trust for many, many years, loads of staff engagement was done. It never was the right people that were engaged. So, and engaging the unions and making sure that the unions are involved in that piece as well. I'm trying to think what else. Back to the communication, that piece around those empty theatres in SWA. Again, I worked in the trust for 15 years. I didn't know that they were for NI overskill, so I thought they were for the trust. So that's not been communicated either. Do you know? So again, it's just all these kind of, you're talking about the fake news that's out there. It's allowed to be spread because the facts aren't out there. So I think it's just about sharing that information very clearly. I'm glad to see the improvements. Obviously, all we want is patient safety and people to be better and people not to be sick, you know. So I think that the stats are good and I appreciate them being there. I was going to ask about the new ED as well. So I know that someone else got on before me for that, but I'm really disappointed to hear that that's actually not been kind of added to any, from a governmental, not from your point of view, but from the government's perspective, that there's no budget being allocated towards that, given that we are the oldest ED and given some of the horror stories that are coming out. Trying to think, is there anything else that I wrote down? Again, I think it's important to put it out there publicly around it's the why the bed blocking, you know, and why A&E is the way it is. And we all know, well, I don't know, I kind of presume everyone knows that it's more to do with the kind of social care element of it. It's people who can't go home because, or can't go to nursing home or don't have the care that they need, and they're sitting in the bed in ward, whatever. And that's why John and A&E can't go to ward. You know what, like I know that, but I don't know if everybody knows that. I think it's getting better. I seen something on Facebook or Instagram recently and it was like, if you can bring your loved one home. But I also seen all the comments being like, that's not our job. And, you know, it's a constant fight. But yes, I think my main thing was the work streams, making sure the right people are engaged, making sure that whenever we're communicating, it's really clear and transparent, and making sure that, you know, listening to those kind of stories from the Save Our Kids services, maybe look back and watch their presentation to us and hear the stories. So then whenever you are going on to meet with them, you can kind of actually anticipate and not have those conversations as well. And, oh, just on the cross-border working too, I think you've done a really good job in giving us even more argument for constitutional change. I think that's where I'm coming from that perspective, but we'll not go down that route now. Thank you very much for coming in, and I do appreciate all the good work because I know it is hard and I know there is a lot going on. Thanks.
Certainly won't, I won't go down the road because we are an apolitical organisation, as you know. Just in terms of the medical beds, I will want to highlight a couple of things. We have unprecedented blockages in terms of delayed discharges, we call them. It's basically patients who are ready for medically fit for discharge and can't leave the hospital. I do want to acknowledge the work that one of my directors has done in relation to Altnagovan Hospital. On a week-to-week basis, in the last 3-4 months, there have been no patients waiting as a result of domiciliary care not being in place. We've transformed our domiciliary care with the support of the providers of domiciliary care in this area. We've done what's called rota optimization. Everybody wants the domiciliary care in the same half-hour slot in the morning, same hour slot in the day, and same slot in the evening. By everyone working out that little bit flexibly, you know, moving it early, moving it slightly late, we were able to accommodate the equivalent of 200 whole-time equivalent staff members with no extra cost to the health service. We were able to, and that transformed, that means that there's no one waiting to, on a day-to-day basis in Altnagovan. Are there the same numbers waiting? Yes, because our population is getting older and they're now waiting for dementia places and nursing home places. And that is a real barrier. You cannot turn up capacity in those areas overnight. And I don't know where the money's going to come from for that extra capacity in this area. We have the lowest number of nursing and residential places in Northern Ireland by some considerable margin. When you look at it, hundreds of beds less in this area. But The Department of Health will tell us we've spent an awful lot of money on our acute services. Therefore, that's where the money, because we do get our fair share of allocations. So it's all about choices. So that's, again, just to go back to that point, I can assure you the staff engagement will be genuine. The last session, we have 12,500 staff, I think, that if we count everybody. And it's extremely challenging. There's no point in me pretending, Catherine, that it's easy to communicate with that size of an organisation across 3 counties of Northern Ireland. And I'm sure there are people in my organisation who believe the engagement isn't adequate. And we will continue to try to engage. But when we have the staff engagement sessions, it isn't just doctors in the room. In fact, the minority of those people, the first session we spent there, it was really, really interesting. It was extremely heated, because there's hot topics we're talking about. But it was interesting when we came to the end, one of the nurse managers in one of the wards said, of course, the big problem is the fact that we don't have domiciliary care and nursing home places in the southern sector to get people out of this hospital. That's what causes it. Because I do have to say, domiciliary care in rural areas and for Fermanagh and Tyrone is a real problem. Whereas we've cracked it in the northern sector and in rural villages, it's really, really problematic. And that's true across the UK. We have to, once we get our new tender out of the way, we will have to sit down with community bodies and see, is there any way in which we can do this completely differently to maximise the capacity for local rural areas? I think I've answered most of your question, or certainly referred to them, Catherine.
Could I add one point now?
Yeah, sure. Sorry, Teresa.
No, it's just to say really on that point about how we're improving access to medical beds. We have had investment this year from the Department of Health. We got that earlier in the year, about £2 million. So we have been doing a series of changes, both within our EDs and acute medical units. So that's the kind of fast flowing areas to make sure that they work really well. But we've also been investing in medical beds for patient flow. So at the moment, just actually yesterday, we opened a small number of new beds, and they will grow as we come into winter to enable us to have more capacity. So there are very definite on the ground things happening, councillor, that are and people working terrifically hard to make sure that we have resilience as we go into the very difficult winter period. As we know, staff engagement and communication is always a mix of having a nice formal and structured approach and having, an informal approach and good levels of visibility and interaction with staff. And we're trying in this work to do both very well. So, of course, you can never give assurances and you can never keep everyone satisfied, but we will try tremendously hard on that, and I can certainly give you that undertaking.
Can I just come back? Sorry, I realised you didn't answer your first point in relation to the amount of time we're taking in relation to this. And I hope I wasn't misconstrued. Please don't misconstrue what I'm saying. I'm just very conscious. We are a £1 billion organisation delivering 10 million interventions. We have a crisis in mental health in this area. We have a crisis in primary care. We have a crisis in our medical beds. We have a range of financial challenges in health and social care over the coming 18 months. It's in that context. So the management time we're spending on this, we're not spending overseeing mental health services. We're not spending on other things. And that was what my board challenged me with very, very loudly at recent meetings, saying, what's the opportunity cost of all this, if we are delivering the outcomes? But you're absolutely right. We have to bring our public with us because we're a public service. So it's that real dilemma we have. But we've got a program management office now. We're going to have our vision. We're going to change the narrative, and we're really, really going to try our best on it. Will it be successful? I don't know, but it won't be from a lack of trying anyway. Councillor.
Thank you. Sorry, can I just come back on that 2 seconds, actually? And I wasn't trying to offend you by saying it. I just think it's really important how it's said and how it's delivered. Just like that kind of piece around, like you said, bringing the public with you. I think it's just really important to highlight that.
Thank you. And Councillor McDade, just to go back, one of the things that I'd like to completely refute is there isn't a single bed that is free in the Western Trust. We have no empty beds anywhere. So yesterday we managed to open an additional 6 beds. We're hoping to increase that to 12, and we're really trying hard to push to an extra 19 community beds. We are short of beds everywhere, and you know the reasons why. We can get patients into hospital, we cannot get them out of hospital. To give you an idea, and just some figures myself and Mark were able to remember. So today, Southwest Acute Hospital has 31 escalated beds. Now think about that. Why on earth would we have 31 escalated bed spaces if we had empty beds in the same hospital? It doesn't make sense because it's not true. We have 42 escalated beds in Galvin today. So we are nursing patients where we can, as safely as we can, because we have to get them out of the emergency departments. And that's both departments, Galvin and SWA. Because if we can't get patients out of there, there isn't cubicle space to assess patients, which means they grind to a halt. So one thing I can try and get across, we do not have a single empty bed in either Southwest Acute Hospital or Galvin.
Thank you. I'm not sure. I didn't say there was any empty beds. I'm trying to think, did I say something that implied that? Because I know there's not. I know that's a big part of the problem. And actually that's what you've just said about opening them kind of the escalation process that are now in place for winter pressures. No, I appreciate them. I'm just wondering, did I say something? Because I've said it wrong if I did.
It's just about the ongoing narrative that there are empty beds. That's all. Just to try and
Absolutely.
put that to ground. Thanks.
Thank you. And the next indicated speaker is online, and that's Alderman Hussey. If you want to go ahead there, Derek.
The opportunity, Chair. I'm not a member of committee. Welcome to the delegation. Couple of points. If I start with the communication issue, can I welcome the fact that the initial consultation was paused to enable this wider consultation? And I think some members have already touched on it. There was a misunderstanding of the actual situation and those impacted, and it was felt very, very strongly, particularly within the West Tyrone area, Hasselberg, myself, like Caroline, and there was that whole issue of we were being sidelined and not part of the consideration of the future of Southwest. But I welcome the fact that you have explained your whole communication process is being changed to look into that. Couple of points. A lot's been covered. The cross-border cooperation, and Councillor McDade, I will take a different view than yourself on the unity issue, but I do wholeheartedly welcome cooperation for mutual benefit across the jurisdictions. And indeed, I well remember Michael McGimsey at the time of the Northwest Cancer development, and Michael pushing on that whole idea that this was a service for the Northwest, not just for the Northwest of Northern Ireland, but for the Northwest of the island. So cross-border cooperation is logical and should be continued. The issue of elective treatment, absolutely no concerns with what you have said there in regard to, wherever the specialisation is available, that's the place to go to. It's not a case of having specialists in every nook and cranny throughout the country, and it's a recognition that centralisation of some services is necessary. On the issue of emergency response, ED, it's not just about travel time. It's also about what actually happens when you get there and how long you may wait when you get there. I'll utilise my colleagues have heard this one before, because I myself had to go into ED in the early hours of a Monday morning or Tuesday morning. My wife went online, checked with Galvin. There were 123 waiting in Galvin. I said, to hell with that, Southwest, here we go. Went to Southwest, got straight through, absolutely immaculate consideration by the staff at Southwest, and I cannot praise Southwest enough for what they were able to do for myself, and I'm sure for many, many others. And it is that sort of situation that makes us in the southwestern area concerned at any indication or hint that there is a threat to the hospital. And I go back to the old Tyrone County Hospital and to all of the situation about the closure of Tyrone County and death by 1,000 cuts and all of that. And we were beginning to get that sort of ambience around Southwest Acute. And I hope that that can be dispelled and that the future of Southwest can be assured going forward. Within that, sorry, can I just mention, within your presentation, you said there were 3 responses to the recommendations coming through with regard to the Southwest. You didn't allocate the responses to the recommendation. Which of the recommendations do you have no issues with? Which of the recommendations are you taking into consideration and investigating further? And which of the recommendations do you reject? I think that is something that needs clarification on as well. Thank you, Chair, for the opportunity.
Thank you, Derek. First thing I would say is there's been absolutely no correspondence or communication from the Western Trust in any way which threatens in any way the emergency department of the Southwest Acute Hospital. The only language that's come out of that has been social media, going viral, which has said before our consultation events we were due to plan, was saying that our maternity service was going to close, our emergency department was going to close, and our ICU was going to close. Clearly, that heightened public concerns. And that's one of the issues we have as a public body. It's extremely difficult once a social media post gets viral support across thousands of people. It's extremely difficult to stop that. So I would call on everyone to stop that sort of post against Southwest Acute Hospital, because I think it has a very, very excellent future to meet the future needs of this local population. You're trying to put in relation to our response to the roadmap for the Save Our Acute Services. I think we owe them a courtesy to just talk to them first, Derek, before we go in a public meeting, a relatively public meeting, and outline our detailed response to each recommendation. I would say that we have tried to meet with Save Our Acute Services frequently over the last 3 years. It hasn't happened yet. We have tried to arrange a meeting for next Friday, and we do hope that that meeting happens. But I think it'll be disrespectful for me to sit here today and outline our position on every recommendation. So I would prefer to have the courtesy to actually meet them face to face and present them accordingly. Afterwards. And we're happy to provide that, Derek, to the council after that meeting in full, because we will do so, and we will commit to doing that. And finally, I do hope you've made a full recovery, and hopefully the services of the Western Trust met your needs.
With regard to recovery, I'm still in recovery mode. With regard to elective, I can't give enough praise to haematology, for example, in Galvin and the excellent work that I'm experiencing through that department. So with regard to the service that we get, first class, but all of those concerns that exist for our electors have to be addressed as well. And I welcome the opportunity that when you've had the opportunity to initially present your responses to the Southwest Acute Group, that we will get some indication of where we're at on that. So thank you very much. Appreciate it.
I suppose my final point would be we wouldn't have a Northwest Cancer Centre if it wasn't for the support of the Dublin government. Be clear, we wouldn't have, it's not just about money. Yes, we got funded for the capital and we're getting funded every year for the revenue. We wouldn't have the right number of patients to make it a sustainable model. By moving in towards Donegal, all of Donegal and related populations, we're able to combine and then get enough patients needing the cancer treatment, and thereby having enough to sustain an excellent cancer centre for this area. And then when I say we are the beacon site for cross-border work, and that's a prime example of that.
Yeah, and as I said, that was recognised by Michael Magipsy at the time, if you remember.
Thank you very much. Yeah, so the next indicated speaker is Councillor Duffy. Go ahead, Sandra.
Thank you, Chair. And Derek, I hope I'm not as old as you, but I remember that as well. Thank you, Neil and team, for coming in today. I have to say I found it really informative. There was clear information that was being provided, and it really did dispel some of the myths that have been out there. I have to say I was not at the meeting where so was presented. So I wasn't hearing the information directly from them, but I did receive their report and their roadmap and their asks. And I have to say, as somebody who's not a clinician, you can understand where those asks are coming from. But I just want to comment today and start off with, Neil, with yourself. One of your opening statements was that what you have actually done is you have transformed healthcare and you have improved outcomes. And then you went on to clearly present some of the data around that and how you have the death rate has been lowered, and there is lower complications, there is lower readmissions. And I think all those have to go into the public domain, because those are the key pieces of information that we all want to know as users of a health service. And we want to know that those are the three outcomes that are going to be improved for us all as users, for our families and all the rest of it. So I think that the information that you have presented here is very clear. I think, Teresa, probably the key bit of this is around the work streams, and it is around agreeing the new narrative around this, because I think that what has happened is there is a narrative out there at the minute that is probably damaging, and relationships have not been good, and I think I'm fair enough to say that. But at this stage, we do need to agree the new narrative. We have to ensure that this information is out there in the public domain, because I think if that information is out there, nobody can argue with that, because that's what we all want to see from the health service. So that agreeing the new narrative, the public information around it, and the communication piece, that is what's absolutely key. We all know that patient safety and outcomes is paramount, and the information that you have presented here today clearly demonstrates that, and clearly debunks some of the other information that has been out on social media and out and doing the rounds. So I think that that's really important. I do look forward to hearing back from the outcome of the meeting that is scheduled for next week. I hope that does go ahead. I think it's really important that we try and get that done as quickly as possible, because I think that the information out there has been allowed to fester a little bit. And I think that if we can get that meeting done and start moving forward with what the piece that Teresa has outlined around the visioning and the work streams and that new narrative, I think that's going to be absolutely key. We know where the challenges are in healthcare, and that is around our domiciliary care and those flows back out. Those are the challenges that we're all facing as an ageing population here. And I think that's what we need to be concentrating on, and we need to be working forward on. I do think around the wider piece around the cross-border, we have done a lot of work, and I think that it's really key. The Northwest Cancer Centre is a beacon for all the work that we have done. We have demonstrated that as a Northwest City region, that we have the population to move that forward, and I think we need to continue to do that. I just want to say I'm certainly convinced with the data that you have presented today to us, and I thank you for coming in and appreciate your information. So get it out in the public domain. That's where it needs to be. So thank you.
Thank you. Yes, totally agree with everything you say, Sandra. Obviously, I suppose in relation to the work streams, our board, has spent a lot of time in this, Chair, just to reassure everyone in the room. This has been agreed by our board. Just to go back to also what Catherine said, this is a key priority for our organisation, and it will have. You can be assured, and my organisation will be assured, that our improvement through involvement committee, we felt, should be the most appropriate committee to oversee it, to ensure that, one, we're continuing the improvement, but also we're involving people. So it really did sit properly in that committee. They will oversee the progress of this, and they will report back to our trust board regularly. So there will be proper oversight. It will be a priority. The engagement will be a priority, and our improvement will be a priority. But finally, my final comment will be, we're extremely keen to engage with Save Our Acute Services. My organisation has been reaching out consistently over 3 years, but You know, I think we should draw a line in the sand and let's move forward now. You know, whatever's happened has happened. Let's move forward and into a new relationship, because you know we have improved and we believe we can move forward as well.
Thank you. And the next indicated speaker is Councillor Harkin. Go ahead, Sean.
Thank you, Chair, and thank you to Neil and all the Western Trust team for coming in today and sharing your report with us. And on behalf of People Before Profit, I want to thank everybody who's part of the Western Trust for the work that you do day in and day out. And we did pass a motion here last month supporting the demands of the Western Trust staff and all the staff right across the north for pay parity. And it looks like after a series of announcements that the money has been found to meet the bare minimum payment or increase for staff. And I think that look, any improvements the Western Trust or and the health service is able to make, the HSE across the north, I welcome it, because we want to show that a publicly funded health service can work and can improve and is the best way for people to kind of keep themselves safe and for lives to be saved. So that information about the hard work that people are doing and changes that people are making to lead to positive outcomes needs to be out there as much as possible, and people need to be properly thanked for that. But I do think for a lot of the staff, in terms of like the bad feeling about the health service, again, when people see staff threatening to strike again over the same issue that they were promised last year and the year before, they would never have to strike on ever again because it would never happen. I think that gives the impression of an organisation in turmoil, which is not actually your responsibility when it comes down to it in terms of the pay and conditions. But it does seem, from the point of view of government, when you know, the safe staffing and rebuilding capacity is such an important element to the work, that for people to be threatening an all-out strike, you know, Thursday, Friday, Saturday, Sunday, Monday, with no derogations, because that is the level of anger, that undermines safe staffing. Because if you want to retain staff, if you want to attract staff, this is not the way to go about it. So, you know, I think that getting out the positive messages about the good work is critical, but I also think government has to take responsibility for the part of the public narrative about the health service. If you can't treat your key people or your staff properly, it doesn't look well from the point of government. I do want to also commend Neil and others who have stood with the staff when there's been racism, because we have a very diverse and multiracial staff that are, you know, at the backbone. And I think it's very important that we've sent that powerful message about we won't tolerate racism, because again, you know, you will see on social media migrants, asylum seekers getting blamed for waiting lists and, you know, lack of access to A&E, and it's a complete and utter fabrication. I mean, it's total misinformation. And I think we have to do everything we can to push back against that. And look, Neil, I'm glad that you're saying out loud again, because we talk about these issues constantly in here, about we face not one crisis, but multiple crises. And all these crises gather together and put enormous pressure on our health service. And that's where you really see because it ends up where people are getting hospitalised, people are unwell, whether it is physical ailments, whether it is mental distress, and it comes on the health service. And obviously the health service is just not properly funded to deal with all this. And that is going to be funding and then spending the money properly is critical. But just on, I know the discussion about privatisation or private services. I mean, we've also discussed in here recently about the reliance now on private ambulatory care and how much we're spending on that, 50 million over the last 5 years. But it's clear hundreds and hundreds of millions of pounds of public money are being spent on private healthcare. So there's a massive growth, and it's a very profitable growth for the industry that has become the private care industry. It is growing as the Western Trust and the HSE struggles. The private care sector across the north is actually growing, and is accessing all sorts of pots of money. And I think that this is a real problem, a deep problem, in terms of addressing all the crises that you're mentioning, because they are not set up to address those crises. They are set up to make profits. And it's only a publicly funded HSE that will actually take responsibility for addressing the crises. So I think that is, that is a big fight. The last one is just about, obviously, you're here to talk about the SWA and about the acute services. I think that the people from the SWA made a very compelling case in terms of their campaign and what their demands are. I think part of the issue is that the Bengo reform type proposals, which talk about centralising care and removing it out of local areas, I mean, there's been widespread opposition to that by everybody except the executive parties, in terms of trade unions, local communities, because there's such a high level of distrust. Now, the distrust wouldn't necessarily be aimed at the Western Trust leadership. It is aimed at government, because people just don't trust what government is doing and think that any changes are based on austerity, and it's about the withdrawal of services, and then that means less access, which means then that if there is a challenging situation or life and death situation, you might die. So I think that is what's driving a lot of the, because the turnout at the meetings that have been organised by the Save Our Acute Services campaign have been enormous. And I don't think it's just based on fabrication on social media. I do think that they have probably helped I think they've shown the level of concern and the desire for local access to services. So we'll stop there. But again, thank you for coming in today.
Thank you, Sean. And I suppose just to go through your 8 points. The first one, in relation to pay parity, I thank you for your support and thank Council for their support in relation to that. I am on the record consistently saying that health staff deserve to be treated fairly in relation to deserve to get pay parity. You say that somehow the money's been found and the strike chaos and turmoil has been avoided. Yes, I'm still waiting for the money to come through, but there is a commitment. Minister's announced it, and I'm not going to start questioning where the money's coming from, Sean. Quite frankly, we've been told it's going to go into the bank accounts in February. Every member of the staff in the Western Trust, and indeed Health and Social Care, deserves their pay award this year. I think it's, I'm on the public record saying, why should some public servants get their pay award and not health service? I understand that the Department of Health have changed their approach for next year, that the pay awards will be first in the financial strategy rather than being the last, they've thought. So next year will be different. We'll see next year. In terms of publicly funded health service, free at the point of delivery, no one in this room is more passionate about that than me. I've given my entire career to the NHS. I can assure you, I can look you in the eye, Sean, and say the Western Trust is wholeheartedly committed to that. Yes, we will use the private sector where it's appropriate to help patients get faster access. But you're absolutely right. At times, the Department of Health and the system has over-relied on the private sector, and we should have been building up the capacity in places like the Western Trust. But you'll get me on a hobby horse on that very quickly. And Teresa might come in on that. Communication, we absolutely accept. We will be working on that. In terms of the racism and the way society has gone in recent years, I think we should acknowledge that Derry was a bit different. We were the only city, to the best of my knowledge, that didn't have one of those big protests last summer. And to go back to what Sean has said, every party came into the Art McGavin Hospital. Every party was represented, and they heard from my ethnically diverse network of staff and the concerns that they had, and they were scared, quite frankly. And the age of having doctors living in this part of the town and a different part of the town, everyone, my elected representative, my ethnically diverse network, they live in all parts of the city, all parts of the western area. They were very, very concerned. But credit to the elected representatives of this area, there was no march in this town. There was negotiations and influence was used behind the scenes. And that's a sign where you have public bodies working with elected representatives where you can make a difference and we can stand up against the racists in society. So I was really, really proud. You're absolutely right. I think we were the only city in the UK that didn't have one of those marches. So you do mention about the crises in various parts of the health service. I think society and the public sector and private sector, we all have to have a good hard look in the coming years and decades. Only 20% of the determinants of the health and well-being of this population are influenced directly by us. The other 80% are influenced by other public bodies, by people making behaviour choices themselves, and the whole economic environment in which we operate, and housing. So clearly should be. I dream of a time when absolutely everyone becomes a Minister for Health. Everyone has the same role as I have in terms of public health, where they wake up in the morning, what can I do to help my own health today, and take responsible actions, responsible decisions. Because quite frankly, the population, the way the demography is going, if we don't change our behaviours, the life expectancy will plummet. There's no doubt about that. In terms of South West Acute, what I've tried to do today is at least demonstrate that our implementation, whether you agree with it or not, and if there is a lot of different views, at least please acknowledge that we've implemented it in a well-managed way, in a professional way, in the best interests of patients and clients. We are where we are, and I think we should move forward accordingly. But thanks for your comments and questions.
Thanks very much. Councillor Boggs, you want it back in there?
Just very, very briefly, and not to add another layer of complexity to what we're talking about, but I recently attended the opening of the new ambulance station in Strabane, and staff, actually, it was just a couple of days after, maybe, or the day after we had our presentation with SOAS, and some of the staff had been listening in and were aware that the trust were coming back. Can I ask from officers for their perspective, have we received a response from NIAS in relation to them attending committee on the same issue? And separate to that, where does NIAS, obviously sits as a separate trust technically, but where does NIAS feed into the conversations we're having around emergency general surgery and the SWA and across the Western Trust, and how their views are factored into decisions going forward? Because I know they're obviously important, and they also feel that they need to be heard. Thanks.
Yeah. So at the outset of the change, NIAS have been key partners from the temporary change what came about in December 2022. There's a programme board chaired by the Chief Executive, which happens on a monthly basis, and NIAS are key partners at that as well. So we work hand in glove with them on a daily basis. We do use private provision. We use private provision to take some of the pressure off Northern Ireland Ambulance Service, and we work very closely with them on a day-to-day basis. If that provision is not being used for transfer, we use that in the local locality to support discharge to free Northern Ireland Ambulance Service up to do some of the other work that they need to do. So we have a very good working relationship, and changes and plans moving forward will always be discussed with NIAS, and the movement of patients. It's in fact almost on a daily basis where there is dialogue across those services, and that working relationship is seamless.
Karen has an update in relation to the correspondence.
Chair, members, just to say that we did extend an invitation to both the Western offices and then a follow-up to the Central Belfast offices, and we haven't received a response regarding attendance at this stage.
Thank you, Karen. And the last indicated speaker at this stage is Councillor Riley online. If you want to go ahead there, Martin.
Thanks very much, Chair. I'm conscious I'm not a member of the committee, so I appreciate you bringing me in. But I am a member of the AIPB on behalf of Council, so I was watching with interest the presentations, and thanks to Neil and all the team from the Western Trust for coming here this afternoon. I suppose just quickly from each Chair, the slides that we were presented with at the start of the presentation, the thing that jumps out to me the most is the colour and the lack of green on the Derry and City and Strabane District Council area. We are not better than any other council area in relation to our health. And I just swiped through the slides. That deep red really does stand out, and I think that's a very sobering message for us all as elected representatives in the Northwest to be seeing about the population health. Just a question I have for the panelists today, I suppose, is just the figures that are there. Like, for example, in terms of good health, some of the numbers are quite low. So you have the likes of the Moor, where it's number 4 on good health. Foyleside is number 8. But then simultaneously on the same slide, you have very deep red colour for very high numbers. So the Ballyarnett, for example, is 68 for lung cancer. Waterside is 65 for lung cancer. So I'm just asking for a little bit more detail on the numbers that are on those screens. I know it did say earlier in the slide that they relate to the ranking of the DEA out of 80 DEAs, but I'm just wondering why some low numbers are deep red and while other high numbers are also deep red, if there's any clarifications that can be given on that. But thanks very much to everybody who's presented thus far.
Thank you, Chair. I'm happy to take that. I mean, some of the indicators are inverse in terms of being either first or last. Actually, I had to be taken through this myself by Shane, who's here. And what I'm going to suggest for just efficiency of time is that I will have Chris send out that information with the other information that we will be sending out after today to council to share. And Martin, if there's anything, if you want me to have a call with you, take you through it in more detail, I'm very happy to do that and offer that, please, Chair.
Really appreciate that. Thanks, Teresa.
Martin, just to repeat what the point I would make, it's quite clear across the UK, across Europe, across the world, economic deprivation leads to bad health outcomes. There's no doubt, and that's quite clear. And it's quite clear in this heat map. When you look at it, you will see that there's direct correlation across Northern Ireland. And I think that I'm here representing health and social care, but we can't sit in isolation from the actual economic deprivation that has been experienced, and it's manifested in so many ways in these heat maps.
And just through you, Chair, again to Neil and the team, I suppose that answers the first question. Flowing on from that, does the money follow the problem? If we are listed as having like the number 1, for example, there in terms of the Moor for male LE, is there subsequently within the Department of Health, when they come to make their allocations, are they looking at the Western Trust as an area of such high need in terms of patient outcomes and patient difficulties that they are adequately giving the Western Trust the share of the money that they need to make the changes that these slides would suggest needs to take place?
I will answer that in 2 parts. The first, you're really pressing my buttons now, Martin. You're really in my hobby horse as the Chief Executive of the Western Trust in one of the most economically deprived areas of the UK. The first point is, according to the statistics, we are funded to our capitation level. Okay, so I can't go back to the Department of Health and say we are underfunded based on their capitation formula. However, that's the first part. So I'm being very reasonable and measured in that response. I can say to you, and you've probably heard me speaking frequently about this in the past, the capitation formula directs significant resources to the older population. One of the problems when you're in an economically deprived area is that people die too young. Therefore, the resources by inference are skewed away from this area. And there's insufficient, in my eyes, there's a completely insufficient determination of economic deprivation within the parameters of the capitation formula. And what does that mean? It means we don't have the resources then to target additional services to prevent people from dying so young, to make up for the fact that the economic deprivation gives people worse health status. So that is a position I believe is being accepted by the Department of Health. These things will take ages to change. This is a massive thing. I can assure you I've spent the last at least 10 years lobbying hard around the capitation formula for Northern Ireland. The challenge that they have is it's very easy to do a direct correlation between the cost of care for the older population, because internationally, it's very known that an 85-year-old will consume, I think it's around about 11.5 times the health and social care resources of a 55-year-old. But how do you actually quantify the fact if a person doesn't live until they're 85? How do you actually put a cost on a life? You know, that's the challenge for them. You know, yeah, that's not for me to determine, but someone has to step up to the plate and actually recognise that the health status of the population should be the most important thing in any capitation or in any allocation of resources for Northern Ireland. So you got me on a hobby horse there, Martin. Apologies for that.
Thanks very much. Is there any other indicated speakers on, go ahead, Catherine?
Sorry, thank you, Chair. And do you know what? It's actually nothing to do with the presentation. It's about your hobby horse because I'm going to join you on it. So you were saying that you've been lobbying on this for like 10 years. Is there anything that we can be doing to kind of join that sort of argument? Because if a man in Bangor can live to these 85 and a man in Derry, Ballyarnet's my area, is going to die before they're 70, we need to be kind of pushing that more, because what comes first, the chicken or the egg, the deprivation or the health? They're both so interlinked. So we need to kind of look at the formula and see about how we do it. So do we need to be getting, we probably are on board, but like what more can we do to push that forward more? Because it's just not fair.
Well, I suppose there's two things. You know, I'm a firm believer, you've got your area, which you're excellent at in terms of the economic development of this area. You're doing fantastic things with the city deal. All I would ask for you, let's supercharge that to transform this population's economic development. Secondly, in terms of challenging the Department of Health in terms of their allocation, to assure you that the population of the West and the deprived, that there's an appropriate adjustment for economic deprivation. That's up to this council. I'm not going to sit here and lobby against my Department of Health. We have an excellent relationship with them. And I keep saying we are funded appropriately according to the capitation formula. But I think it's important that the public sector and we all stakeholders have an adult conversation about what is the impact of economic deprivation on health status, on society, and all the problems we have in society. That's all I ask. Rather than just complaining about give us more money, let's have an adult conversation about how we all can work together to actually address the societal impact of economic deprivation.
Thanks. No other indicated speakers then. So it just leaves me to thank you all for coming on today. We really, really appreciate the fact that you came here with so much in-depth information to give us a look at the type of work that you're doing, which in my opinion isn't easy. So I really, really do. The reason for coming on today was because of the SOAS presentation. So I really do wish you the best of luck for the 21st of November. And I hope that that meeting is a new pathway to communication, to collaboration, and getting to the nuts and the bolts of the problem and seeing what the best solution would be. But you did mention earlier, Neil, around the primary care and the mental health crisis, and I wouldn't want to leave this meeting without commending your health improvement team, who I feel are a huge piece of the puzzle when it comes to engaging with the community and voluntary sector and providing those early intervention tasks. One particular programme that I do want to refer to is the Think to Wellbeing, which we all know is working fantastically in relation to trauma and orthopaedics. But also when you look at the work that the MDTs are doing in relation to primary care, and you're looking at all of the leadership groups that your health improvement teams are sitting on and hearing the grassroots problems that are existing out there. We're talking about socio-economic areas of high deprivation. The Moor Ward's one of them. I represent the Moor Ward. The Love Better project was injected into the Moor Ward with zero resource. So there's an issue in itself. The outcomes needed to be withdrawn from the area with the most high area of deprivation, but there was no resource put behind it. So it's as if you're fighting a losing battle. But I just couldn't end this meeting without commending the health improvement team. I suppose I probably work face to face with them through the work that I do with in the community, but they are doing amazing work, and that early intervention piece with them is very important as well. So thank you all very, very much. And I, again, wish you the best of luck for next Friday, and we hope to hear a really good outcome from that meeting.
Thank you, Chair, and I really appreciate the invite tonight as well. So it's really, really good. We have such a good relationship with the Derry City and Strabane Council, and we really value it. Let's work together into the future. Thank you.
You're free to stay if you want for the rest of the meeting. Okay, thank you very much. Safe home. So members, we will get we'll go on with the meeting under chairperson's business. Am I right in saying, yeah? So, sorry, Paul, did you say? Oh, sorry, yes, a wee 5-minute break. Go ahead. a chairperson's business. There are 5 items, 3 of them are from me, so I'll fly through my 3 first, if you don't mind. The first one is in relation to the Pathways Out of Poverty plan that had been drafted through the Anti-Poverty Task and Finish Group. Myself, Councillor Donnelly, Councillor Harkin and Councillor Tierney had met with the NIAPN, Foil Food Network and the Focus Project on Tuesday, and what I would like to do is ask Una McGillion and the team if they could please look at forming the task force to look at the free school day, which was one of the actions which was within the Pathways Out of Poverty. So if we could write to that team just to see if that task force could be set up as soon as possible. So the second item on my agenda is the Civic Dollars initiative by Developing Healthy Communities. So this is an initiative targeting pre-diabetics, and it's basically a mobile app that rewards people for being outdoors and taking part in events at leisure centres, parks, green spaces, where they'll earn dollars in certain zones that they can spend in local businesses or donate to local charities or schools. I think it's a really, really brilliant initiative. It's a great way to get people outdoors, and it's a great way to engage with people that have a pre-diabetes diagnosis. So there is a lot of information in relation to that on the Developing Healthy Communities website, and I would just like our council to promote it, to get it out there, to get more people involved, because it's a very, very worthwhile project. Thank you.
Chair, can I just on that, because thank you for raising it to start with, because you're the only person that I have actually heard talk about it. If it be possible to get some information shared with members as well in relation to it, because I think it is a really worthwhile scheme, and I've heard you talk about it a number of times, but I haven't really seen anything else. So if we could get some information shared, that would be great.
Definitely, and there is a deputation pending with the team from Developing Healthy Communities and the PHA, so it'll be widely discussed at that as well. But no, Sandra, I'll get a few bits and pieces out to you. There's some information on the website. So members, the third and final chairperson's business from me is in relation to Danny Quigley. As you all know, was the recipient of our Freedom of the City Award for his mammoth physical activity challenges to raise money for mental health services here in our city. Danny will embark on his 3rd challenge, leaving tomorrow, where he will run 200 miles around the Sahara Desert. I think over the past number of years, we have seen firsthand the benefits of the money that Danny has raised in relation to mental health services throughout our city, and in particular, a lot of focus with that money has been put on one-to-one high-level counselling sessions, where individuals and their families are receiving the best treatment possible in order to give themselves a better life and recover from some trauma that they have been going through in their lives. So I think it's safe to say that we're all behind him once again. We wish him the very best of luck. We want him to stay safe. And if we can just send a message of support to Danny, and we will see him whenever he gets back after running in that heat for 200 miles. Fair play, Danny. Councillor Harkin.
Thank you, Chair. Yeah, all the best to Danny Quigley. That is a huge undertaking, so fully support him. But Chair, I just wanted to go back to your first item that you had raised, and I think that the meeting that we had with the Foil Network Foundation, the Focus Project and the Northern Ireland Anti-Poverty Network on Tuesday was excellent. I think people were able to tell us about the work that they're doing and the pressures that a lot of households and families are feeling because of the cost of the school day. So I fully support the proposal to follow through on our pledge to set up a task and finish group to work on what the council can do to address the cost of the school day. I think we want to aim to have a free school day, but that's not where we are right now. I mean, the legislation is out for the school uniforms that people put a lot of work into, and the response so far is very underwhelming because people don't see how this is going to help a lot of the most deprived families deal with the rising costs of school uniforms. We have seen a 20% hike in the cost of school meals. That's been put through by the department recently. We also know that thousands of families have been turned down from access to the free school meals and the uniform grants because of the threshold, and that threshold should be higher. So I think government isn't doing enough. So I think we as a council have to look at what we can do, and I think that there's probably a range of things that we can identify to help people. I think that the Focus project in particular doing great work. That was one of the things that was clear out of the meeting on Tuesday, that their scheme, which was started in the Rathmore Centre, has been, a lot of people give, but a lot of families have also benefited from it. And I think we should do what we can as a council to support them and figure out means of doing that. But yeah, look, I think we know that a lot of families are struggling, so I think we have to do everything we can as a council to help them.
Thank you, 100%. Councillor Harkin. So the next item on chairperson's business is from Councillor Boggs.
Chair, and I'll be brief. It's just to congratulate all those who last night received Lifetime Achievement Awards from Tyrone GAA. And I am going to name a few and run the risk of leaving somebody out, but those that I am aware of are Doc Mackay, who was awarded a 50 years of service as a founding member of Owen Rose GAC in Glenmornan, along with Paul Phillips and Joe Hegarty from the same club, who both got 25-year awards for their service to Owen Rose, and also to Liam Sweeney from Sigerson's GAC in Strabane. So I want to congratulate them. I think it again highlights the true spirit of the GAA right across our communities, that people give so freely of so much of their time over so many years to build our GAA clubs to what they are, and we are very proud of them. I would ask that officers engage with the Mayor's office. I know the Mayor is away at the minute, but I would ask that officers engage with the Mayor's office about whether we could maybe go out to all of our GAA clubs right across the City and District and pick up on anybody else who's achieved a lifetime award or any of the awards from their county boards, and that the Mayor recognise that in whatever way he sees fit. But I just want to congratulate those within the area that I represent that I'm aware of at the minute. Thanks, Chair.
Great stuff, Councillor Boggs. Thank you. And the final item on chairperson's business is Councillor McDade.
Thanks very much, Chair, for letting me come in on this, because it's off the back of the deputation that we've just had there. It's just, I wanted to make a very quick proposal. If people are happy with it, I'll send it to Paula here. But I just thought that after just that last kind of comment that we were having with Neil around the I don't know if I even said this right now, the capitation formulation, is that right? Around maybe inviting the minister. I know he might not show up, but inviting him to come in and have that discussion. So I'll send it through to Paula, but that's all it is, just asking the Minister for Health and the department to come through and talk to us about it, if that's okay.
Catherine, if that's agreed by everybody, you wouldn't need to really say anything through to Paula, because Karen can take that as an action. Is everybody in agreement? Is that okay?
I'll send it in.
Thank you
very much.
Thanks.
That's all it was. Thank you.
You're welcome. Right, well, members, we will move on. Sorry, yeah, we'll need a seconder. Councillor Duffy. Thank you. So agenda item 7, matters arising from the open minutes of the Health and Communities Committee held on Thursday, the 16th of October, 2025. Councillor Duffy.
Thank you, Chair, and it's matters arising under HC 267/25, so it's child's rights, and I'm loosely using this, so apologies for it. At a previous meeting, I had made a proposal around inviting Northwest Baptist in for a deputation. I know that that is progressing through the system, but this morning we met, myself and Maria Hearn from Northwest Baptist, we met with Dublin City University and Technical University Dublin in relation to a pilot that they are, a research pilot that they are running in terms of breastfeeding friendly city. And I know that there has been a lot of work in the past that has been done by the Trust, and I believe that they have a UNICEF gold standard in terms of breastfeeding, but I think that there is a lot of work that we still need to be doing as a city and district, and just the it's very actually pertinent in terms of the last conversation we had around economic deprivation and the impact. And if you look at the statistics around breastfeeding, breastfeeding at 3 months in Hungary sits at 96%, in Europe 60% average, in Southern Ireland 40%, here in the north 28%, and here in this council area 22%. We are the worst in the world. And that's factually correct in terms of statistics. So we need to be doing something. We need to be looking at how we can improve those outcomes. And if we talk about those economic deprivations, the Moor ward is the worst in terms of breastfeeding as well. So when you drill it right down to DEAs, you can see that that deprivation has a real impact. But I think that the work that is ongoing with Dublin City University and the Technical University Dublin, and the fact that they wish to work with us in terms of what we can do to assess what we're doing here and how we can do that better. So I was going to put it in as a motion to full council, but I've missed the deadline because the meeting was just this morning. But I would like to propose the council officers try and pull together a meeting of the Trust, Northwest BAPS and Ulster University, and particularly the nutrition department in Coleraine. And I know we've been doing a bit of work in terms of health inequalities and homelessness with them, to look at how we can come on board with this pilot, because I think that it would be a really good opportunity for us to work together to look at how we can improve those really damning statistics we have around breastfeeding. And we know that breastfeeding can give our children the best start in life. So I'd like to make that as a proposal, if that's okay.
Seconder. Councillor Devine. That's great. Thank you, Councillor Duffy. Okay, members, we'll move on to go ahead, Councillor Bowles, and have you got a matter as well, Catherine?
I'm not so much looking for an update, Mayor, but I make no apology for wanting to keep it on the agenda, because I continue to receive complaints in relation to Early Urban, so just under HC 25225 in relation to the odour issue. I just want to keep it on the agenda. I don't necessarily need an update. Residents are keeping me updated enough to know that the issue is not resolved. So thank you.
That's good. Okay, thank you, Councillor Boggs. Catherine?
Thanks very much, Chair. It's HC 25125, and it's just on the anti-racism again. I know a few months ago the United Against Racism here in Derry had did a cricket tournament, and now they're organising a basketball tournament in January. So I just wanted to highlight it. There's not any confirmed details yet, but highlight it and ask for kind of council support on it, whether it might be promoting it out through social media or maybe even the use of leisure facilities here. But I just wanted to put it on the agenda and put it out there. Thank you.
Thank you. Councillor McDade, any other matters arising? No. We'll move on to agenda item 8, which is the private rented sector legislation, and that'll be a report from Seamus.
Thanks, Chair. Members, the report is to update you on enforcement activity in relation to the private rented sector during the financial year 24-25, and to seek additional staff resource to meet council statutory obligation to implement legislation relating to this area of work. Members, the report outlines legislation which council are responsible for implementing through education enforcement. You'll see in the pack also enforcement data provided by DFC for the 11 councils during 24-25, and also highlighting the current and future demands on council's public health and housing team, which have increased since the introduction of the Private Tenancies Act 2022. Members, additional resources deemed necessary to efficiently deal with this area of work.
There's also potential to achieve additional income through fees and penalties, which could offset the cost of putting in place additional staff resource if approved. And members, the recommendation is members note the contents of the report and approve the recommendation for additional staff resource and to implement the legislation associated with the private tenancy sector. Thank you, Chair.
Thank you, Seamus. First indicated speaker is Councillor Duffy.
Thank you, Chair, and Seamus, thank you for the report. I'm happy to propose the report. I work in the housing sector. I see really, really good landlords and I see some that aren't so good. So I think that it's really important that we have this resource. I know I would refer on it quite a bit at the minute. So I think that we need to resource it if we want it to work properly. So I'm more than happy to propose the recommendation. Thank you.
Thank you, Councillor Duffy. We'll move on to agenda item 9, which is an update report. Sorry, I didn't see your hand up, Sean. Is it in relation to number 8? Go ahead.
Yeah, thank you, Seamus, for the presentation. And I think I agree with the proposal to add an additional member of staff. In my experience and in our office's experience, a lot of people are not treated well by landlords. And there's also a lack of knowledge as well from landlords in terms of how they're supposed to treat their tenants. So I think council is obligated to do a lot more. And I think if we are struggling right now with the new Act and the new responsibilities, then we definitely have to increase our resource to this. And so, you know, that's going to be an expense on the council for ratepayers, but I think it's well worth it. I think that you know, some of the treatment of tenants is shocking, and some of the ways that landlords operate when they're actually challenged is just as shocking. So I think that there is a lot of work to do on this, because I think tenants need to know their rights, and the rights that they have need to be enforced by someone, and council has a responsibility. So I think that I would like us to add 2 new people if that would help the situation, but I think we can start obviously with an additional staff member that's dedicated to this. So fully endorse this. Thank you.
Are you seconding it, Councillor Harkin? So, Catherine. So agenda item 9, the update report, ending violence against women and girls, and that is Barry.
Thanks, Chair. Members, the purpose of this report is to provide you with an update on the End Violence Against Women and Girls programme funded by the Executive Office, to seek your approval to allocate 5,000 on the Momentum Fund to each of the lead partners within the 7 DAs in Strabane Town, and to seek your approval for officers to progress with the proposed initiatives outlined at 2.4 in the report, subject to receiving our letter of offer from TEO. Members, you'll be aware of the funding provided by the Executive Office to support the on-ground initiatives. Since January 25, a number of initiatives and programmes have been delivered across the council area, and you'll see those outlined in Appendix A. Members, you'll also be aware from the update provided at Health and Communities Committee in September that each of the 11 councils received correspondence from TEO in relation to additional funding to support initiatives aimed at ending violence against women and girls, and you'll see our action plan summary in section 2.4, members. Officers have engaged in a co-design process with the 8 local community growth boards to develop action plans for each of the 7 DAs in Strabane Town, ensuring alignments with the objectives of the strategic framework. So in terms of recommendation, members, to note the contents of the report and approve officers to implement the action plan for the additional funding outlined in 2.4, and to seek your approval to allocate 5,000 to each of the 7 DAs in Strabane Town to build on the existing work across the DAs, and approve the issue of letters of offer to the following lead groups, subject to receiving a letter of offer from the TEO, and you'll see each of those groups members in section 5.2. Thanks, Chair.
Thanks very much, Barry. And the first indicated speaker is Councillor Clark.
Thanks, Aisling, and I'm happy to propose this, and I want to welcome the money. I work in the community within Ballyarnett, and I work very closely with several groups in the area that will make good use of this money. We've already started to make the pledge campaign, which is engaging with young boys and men on trying to make the community safer spaces for women and girls. So this is very welcome, and I know that this extra money will go on to some other programme that's very worthwhile. So happy to propose. Thanks.
Thank you, Councillor Clark. Councillor McDade.
Thank you, Chair, and thanks, Barry, for the report. I'm happy to second it. I will say what I've said before, we shouldn't even have to be doing this. It's, you know, I welcome the funding, but it's still, I just think that we need to be moving faster in kind of ending this endemic. I just, under this item, I kind of wanted to ask a couple of questions. This time last year, we had a special council meeting. I'm sure everyone remembers we had lots of the women's sector represented. They were all sitting up along here, and the mayor chimed in from online or something. Do you remember? But I just wondered if we could get an update, 'cause I think there was 10 actions from that as well, and one of them was a women's officer within the council to be, some of the money was to be used for that. So I just wondered if we could get a paper just updating us on the kind of actions that we had agreed at that meeting. And the second thing is quite a specific one around the sports complex and the use of the running track. Just now that we're in darker nights, darker evenings, I've had a few women contact me about speed training and how there's nowhere for them to do any kind of speed training in Derry now, because obviously the quay's too busy and it's too dark to go anywhere else. So they had requested to use the track at the complex, and they were told they couldn't get the lights turned on. They weren't able to book it. So I'm just wondering, is that correct? Is there a reason for it? That's all. Just given that we're trying to do everything we can to end violence against women and girls, these women don't feel safe to go running out in the roads because it's too dark. And when they requested to use a council facility, they were told they couldn't. So I'm just wondering if I could find out why or what the issue is. Thank you.
Through yourself, Chair. Yeah, we'll get a report back in terms of an update around all those actions and the recruitment process around that particular resource. With regards to the track, you can book it and get the lights if you're a constituted group. So they would have to, if someone wants to go out, it would have to be part of a group, or Couch to 5K or part of one of the running groups who've put in insurance and all of those sort of details. But they can book it if they want to go in as part of a designated group or link into our Couch to 5K programme, and they can use the track when that's ongoing.
Thank you, Barry. So that means that if I wanted to go out running now, and I'm not a member of a running club, but I'm a member of the gym, I can't use the track. So there's nowhere for me to go that's lit. Is that what we're saying? You have to be part of a running group or the Couch to 5K, right?
If you want to book the track, if you want to book it, if there's a number of people want to book the track, yeah, it has to be done as an organisation, yeah.
That's maybe something we need to look at as a council then, because that means that there's nowhere for a woman to go run and feel safe. And we're saying that our council's working towards ending violence against women and girls. Thank you.
Thank you, Councillor McDade, and there will be a report brought back in relation to the earlier request. Thank you. Councillor Harkin.
Thank you, Chair, and I absolutely support the funding proposal and hope that that money is put to good use. And I suppose we did have a very intense discussion last year with the women's sector, and out of that came the 10 proposals. And I suppose at some point we need to be able to kind of measure where we are, because the Executive Office is obviously funding organisations to do a certain amount of work. But I think we have to look at the impact, because is it actually working? And so I think at some point we need to have an assessment of that, and that should come from the women's sector in particular. Are we actually making any headway in our attempt to end violence against women and girls? Are we having an impact in gender-based violence? You know, people see what happened in the city on Saturday night. 2 young men were attacked, and you look at the reports every day in terms of the courts, and there's still a tremendous level of violence against women. So I think we have to look at, there has to be an assessment and a measurement. Is what government is doing having an impact? And if it isn't, well, then we have to look at what the strategy is. And obviously that is not just for our council, but I do think that we have to be part of that attempt to say, is what we're doing working, and measure where the funding is going and what the impact is having. So, because I think that you know, Councillor McDade is absolutely right to be frustrated about the fact that we're even talking about this. But we have to be making progress. Otherwise, we have to look at the strategy and we have to assess that. Thank you, Chair.
Thank you. So there will be a report brought back to the December committee on Catherine's request in relation to those 10 actions. And in relation to all those measurements, some of that money was allocated through the community and voluntary sector. So I'm sure they will have the outcomes and the data based on how their money was spent as well. But that report will come back in December and we can take it from there, sure, and see how things are going. Thank you. We'll move on, members, if that's okay, to agenda item 10, and it's Mitchell Park, Castlederg, NI Electricity Networks Limited, Wayleave, and that's Barry.
Thanks, Chair. Members, this is to obtain your authority to execute a Wayleave agreement in favour of Northern Ireland Electricity Networks Limited to upgrade the existing supply at Mitchell Park.
I'm happy to propose that.
Thank you very much, Councillor Devine.
Just to say that it's very welcome, and I've just, even this weekend, we have teams really waiting to get on to that pitch. So, it's because of the weather and all of that. So floodlighting is essential to open it up. So yeah, happy to.
Thank you, Councillor Devine. Have we a seconder? Councillor Boggs, thank you very much. Agenda item 11, the pricing policy on leisure and sports services, and that's Barry again.
Members, this is to seek your approval on the proposed pricing for a new active wellness membership and update members the proposed strategy towards pricing review for leisure and sports services. Members, and linked to the last paper, as part of the funded Derg Active Scheme, members will be aware that we are refurbishing the existing steam room area in Derg Valley Leisure Centre and upgrading the area to offer a new wellness suite to include an addition of a new cryotherapy spa, addition of new infrared therapy bins, upgrade of showering facility, upgrade of changing, and upgrade of general area floors, locker seating and air handling. This will be the first of its kind for council and will move towards a wellness and recovery offering, with cryotherapy and infrared therapy offering distinct yet complementary health and wellness benefits. Members, you'll see in the next number of pages in section 2 all of the benefits of the infrared and cryotherapy. The new wellness suite will cater for existing members and will provide recovery and wellness opportunities to the wider community. It's envisaged that this will bring additional members to Derg Valley Leisure Centre from the local community and the wider district, providing enhanced wellness opportunities for those involved in sport, activities, general fitness and active ageing. Also, members, the multi-sport hub at Melvin Sports Complex is now nearing completion. All new facilities included in the extension will be covered under the current schedule of charges. So you'll see within the key issues section, members, the proposed prices, and as this is a new offering for our leisure department, the following pricing is proposed. You'll see that in section 3.1. Monthly direct debits, 1 month advance payments and 12 months advance payments. And you'll also see in section 3.3 the pay-as-you-go option, members. These rates have been benchmarked against other facilities with similar offerings and provide value for money in comparison with other provisions in the wider area. Members, it's proposed that the Leisure Price Working Group is convened to meet over the coming months to look at this pricing for the active wellness membership and the wider leisure offering across sites. As members will be aware, this will form part of the new financing strategy for the development of strategic leisure projects at Templemore and Strabane, and this will also include discussion around new prices for the new Melvin Sports Hub. Just again for your information, members, Derg Valley Leisure Centre now will hold a series of taster sessions in December with local clubs, user groups and individual members to gain feedback on the new facilities and proposed pricing. This feedback will be collated and brought to the pricing work group for consideration, and these will be free sessions to those particular groups, members. It's envisaged that the new facility will be fully operational and open in January 2026. So in terms of recommendation, members, that members approve the new proposed pricing for memberships and pay-as-you-go facilities, and that members note that the pricing working group will be convened to discuss pricing for Derg Valley Leisure Centre and the wider leisure prices. Thank you, Chair.
Thank you, Barry. Councillor Boggs.
Thank you, Chair, and thanks, Barry. Just because it's been mentioned within the report as well, can I just welcome the progress at Melvin? We had a site visit there today with officers and other councillors, and most importantly, the boxing clubs that are local to Strabane. And I think everybody has heard loud and clear the need to use the opening of the facility in the new year as a way to fully progress and start to capitalise young people getting involved in boxing again in Strabane Town. So I just want to use the paper to highlight that as well, and thanks officers for facilitating it. Can I ask one question first and then get a response and then come back in again, if you don't mind, Chair? Is under 3.1 the proposed pricing, is that a change to what the likes of me would currently pay, the 29.95 figure, to use all of our leisure facility across the City District, or is the term active wellness membership something new and different, or is it what is? Do you know what I'm trying to say?
Through yourself, Chair. Yeah,
What direct debit I pay for anymore?
you're referring, Councillor Boggs, to your all-inclusive membership, and you pay $29.95. The suggestion here is for this wellness facility, both the infrared and the cryotherapy, it'll be an additional £10 per month on top of your membership for unlimited access when the building's open, but it won't change at the other sites, you know, in terms of if you just want to continue to use Riversdale, Melvin, or someone wants to use Brook Park, Tampamore, those memberships aren't being proposed to be changed. This is an addition for Derrick Valley. So it would be £10 in addition to your existing membership, and you would have unlimited access to those facilities, subject to you being able to book them, because there may be, lots of people looking to book both facilities. So it's £10 for unlimited access per month on top of your membership.
Oh, so that remains optional. Even if my membership is based in Derrick Valley, although all-inclusive membership, you can use any of our sites, I can choose to stick with the 29.95 if I think I'm not going to use any of these. But also, and that probably to declare an interest, obviously, as a membership holder, but if I usually use Riversdale, but now also want to use the facilities at Derrick Active, I can increase my membership by £10 a month and go and use those facilities at Derrick Active. So for somebody who's not going to use any of these and knows that they're not, you can stick at £29.95. But for somebody like me who maybe already pays for the extra to go to Melbourne and use the cryo spa or whatever else, I can upgrade to this new price scheme, so it's not for everybody.
Yeah, through yourself, Chair. I think the idea behind this, members, is that we're trying to encourage people to take out memberships rather than pay as you go. You know, there will be a pay as you go option if you're not a member of any facilities, and you can come and use this infrared and cryotherapy. But the whole idea is to try and encourage people and to sell more memberships. But anyone that has a current membership and doesn't want to use it, that's unchanged. But it's obviously much better value for money adding to your membership if you want to use these facilities 3 or 4 times a week over the course of a month.
Councillor Devine?
Thanks, Chair. Barry, so is there an increase for the concession rate as well? Has that increased by £10? The concession membership?
This is for just for the access here. Yeah, for all of those. So if you have your 22.50 or 29, there's a number of different concession memberships. They remain unchanged. So if you have either of those, it'll be £10 in addition to that, on top of that. So if it's 22.50, it'll be 32.50, etc. But you're not. That's only if you want to use the facilities in Derrick Valley, and that's that top up to each of those memberships. Yeah. So it applies across all of those memberships.
And the benefit, sorry, is it all right if I come back, ask again? So the benefit of that, Barry, is if you were coming on a once-off basis, it would be £10, whereas if you have the membership, you could come a number of times for that.
Yeah, that's correct. Over the course of the month, subject to you being able to get in because the space is limited and book it, etc., and based on the opening hours of the centre. So just as a comparison, these infrared saunas are £15 per go in the private sector. You know, so a £10 a month membership, you could use it 10, 12 times on top of your membership for an extra £10.
Can I, sorry, am I next? Or was there somebody else on before me? Can I just ask in relation to the timing of this and the new facilities opening in Derrick Valley, and then also the overall review of pricing for leisure membership more generally? Do we need to do this now, or can it wait and form part of the overall review of leisure pricing?
Yourself, Chair, we would like to open this new facility that's in Derrick Valley in January, and we have to have a price. We have to have prices in order to open it, and members need to approve those prices.
Yeah, but the working group members, just for your info, we'll try and schedule a couple of meetings before Christmas, and it'll be specifically focusing on the Derg Valley and the Melvin prices. The working group will then meet as next year goes on around the wider strategic stuff, but this will be very bespoke in terms of the stuff we're talking about. So we can have a couple of meetings pre-Christmas in advance of this.
Go ahead, Caroline.
There's nobody else looking to come in.
Sean's looking to come in there.
I'm happy to propose. I know we don't want to see price increases, but I'm content, having asked you, Barry, in terms of the individual cost and the membership, I would be content to propose that we go ahead with that. And again, it's something that I have been promoting, and I know it's eagerly awaited in the area as well.
Thank you, Councillor Devine. Councillor Harkin.
Yeah, thanks, Barry. Look, I think that what's contained in the Active Wellness Centre, a lot of these new services look fantastic, and I'm curious who the target audience is, because it is more expensive. So has council kind of done a study as to who we think would be most likely to use these services in terms of who would benefit most? Because I think council's had a very good strategy around targeting people to use the leisure services more, and that's reflected in the increase in use of our leisure services, which is a very good and positive thing. So I'm just curious about who we think will look to access this, and I suppose these active wellness suites are something we might want to see spread across the district and be available everywhere as well. And I am concerned about the rise in cost, because it's about not necessarily competing with the private sector, but it's about pricing people out of access to something that as ratepayers they're paying for. And we know that there's still huge cost of living pressures. I mean, we're talking about having a task force to address the cost of the school day, the price of meals for children across the district in schools is going to go up 20%. And we know that that is going to impact a lot of people. So that's why I'm asking about who is this targeting? And I think we have to be careful about raising prices, because we don't want to create a two-tier system in terms of, there is advanced services available if you can afford them in the council, but they're not available for the general membership payer who, the cost of a general membership, £30 a month, that is good and it's very good if you're able to access it and use it every day. So in terms of, I'm not a committee member, so I wouldn't sign off on this today. I would want more information about that. But I think any price increase, I think we have to be, careful about it, given the commitments we've made to our ratepayers about keeping it affordable as possible for as many people as possible.
Point of clarity just before Barry, if you don't mind, Chair. We're not increasing prices though against which was the point that I want to clarity on before we propose it. I agree with Councillor Harkin on it, but it's wrong. And I'm not saying that Councillor Harkin is intentionally misleading anybody on this, but it would be wrong of us to say that we are raising leisure prices. We're not. We're putting a new pay scheme in place for a service that we haven't provided up until now.
Through yourself, Chair, apologies if I haven't made it clear. I can provide clarity on that. Councillor Harkin, your first question about the users of this, well, the infrared sauna is a recovery. It's used for recovery. So people that take their sport serious, their exercise, but it's also very common among elderly people in terms of helping them that may have things like arthritis or joint issues. So there's a wide range of people who use it, but infrared saunas are used for recovery basis for people that exercise quite a bit. The cryotherapy is the same again. Not a pleasant experience. It's something that mainly sports people, runners would use. It's an ice bath that's 4 times colder than the sea with salt, etc. And so that's on that recovery basis. And in terms of your question around price increases, No, that's right. There won't be a price increase. So at present, within our pricing and schedule of charges, the cryotherapy spa is £6 per visit per user of the centre. So what we're suggesting is that we group cryotherapy, infrared and our sauna together, that for a £10 add-on to your membership, you have unlimited access to those per month. But there's also pay-as-you-go options. You'll see in section 3.3, there's options in there for the cryo spa, steam room, etc. So if you want to use all of that for £10, that's the value. But if you don't want to take it as under a membership.
Thank you, Barry. And last indicated speakers.
Caroline's.
Paul seconded it, didn't he? Yeah. Councillor McDade.
Thank you. I didn't realise you'd seconded. I was going to come in. Well, that's right. I suppose just to kind of put it in a bit of context around the price, I've booked to go to a private place down on Tuesday, and it's a special offer, and I think it was £14 or something. So a tenner for a month of kind of unlimited use actually probably isn't that bad, particularly because of the kind of target audience. You'll probably find it'll be like football clubs and gated clubs will book it out for sessions and that kind of stuff. So I think that, and part of what you said there at the start during the report is that these free sessions are about engaging around pricing and all the rest of it. So I would have been happy to second it on that kind of basis, that there's going to be that engagement around, is it too expensive? Is it cheap enough? You know, and with the people who are going to use it, because you're not going to just get, you know, Joe Boggs who's going into the gym and then going in for it. You're going to have people who specifically want it. So thank you.
And apologies, Chair, I didn't answer Councillor Harkin's last question again. This is something with our new leisure developments we'll be looking at in terms of, you know, that high-end wellness spa type stuff. So that is something we'd like to see rolled out right across the district eventually as well.
Thank you, Barry. And one last comment.
Very briefly, and it's actually just, and I think it's important, it's the difference between reading a paper and then having officers in front of you, because I was dead against this until I realised what it was. I think we're actually correcting something. Barry and Karen might know, particularly with our walk, jog, run club that takes place in Melbourne. A lot of those people are membership holders of our leisure facilities, but yet maybe go on once or twice a week and pay an extra fee to use the Cairo spa in that location. So it's actually positive in that space as well, that even for people who already use the facilities, it's becoming much more affordable. So thanks for the information.
Thank you, Councillor Boggs. So members, we will move on to open for information, and I'll just go through them one at a time. And if you can put your hand up or shout at me or something, because I'm not seeing hands today. I think I need to go to the opticians again. So the first, item number 12, open for information, is Endometriosis Awareness Month. Councillor Devine.
Chair, thank you. I just want to welcome the awareness campaign. I think it's extremely important, and the work that the endometriosis support group is doing is really great. And I welcome the council's involvement in that based on the motion that came through. This is a campaign about women who are living every day with chronic debilitating pain, and often they feel isolated and they don't have the answers. I think too many have spent years being dismissed and misdiagnosed. Endometriosis takes their health and their dignity of women, and I think the medical support simply hasn't been there for women in this area. So the campaign is really important, but I want to stress that we need to see real action provided by our health services that will deliver early diagnosis and appropriate timely treatment for women. And we need to see a women's health strategy that provides strategic direction to the delivery of high quality women's health services here in this area. I don't want the campaign's important, but I don't want it to be something that the council just acknowledges every year. I think we need to build and turn that awareness into services and our words into investment in women's health. I think women with endometriosis has waited for long enough for proper services in this area.
Thank you, Councillor Devine, and I 100% agree. And what is really stark at the minute is how young girls are that are being diagnosed with endometriosis. So in order for them to live a full life, there needs to be early diagnosis and a good treatment plan. So Councillor Harkin, you wanted in on this as well?
Thank you, Chair, and I want to thank officers for the work on this. I brought this motion forward working with the endometriosis support group, and I think that they will be delighted to see that Council's taken the motion very, very seriously with these different initiatives. And awareness raising is because of the lack of awareness about the number of women that suffer from endometriosis. And I think it's very important that we're trying to address that, and that's to drive home the need to actually create, as Councillor Devine said, a real strategy to address the issue, because often women and other people who go to their GP or engage with the health service come away feeling dismissed and not taken seriously, and that's a serious problem. Now, the other part of the motion was that we were to write to, and it's acknowledged in 3.4 there, to the Health Minister seeking clarity on the health strategy to address endometriosis. I'm not sure we actually ever got a response. And we also included in that motion as well that we would write to the Education Minister for information about how the schools were teaching boys and girls about women's health issues, so that they are no longer a mystery or something that are only discussed with a mother or a parent or a sister, but actually bring that out so everybody would have an understanding of it. I'm not sure we ever got a response from the Education Department to that. We did. Sorry. We should probably republish it, because I'm not sure if what was in it was useful. But look, I think that this is good that we're doing this. I think putting a spotlight in the issue and putting it out in the open and helping to drive forward the request that there's more serious services available, because there's clearly a lack of services at the Western Trust right now. That's what's come through loud and clear in terms of the people who suffer from endometriosis, and people also feel that they're not taken seriously when they are engage, and that includes when people are going to A&E as well. When people are told you don't have what you think you have, and a lot of professionals unfortunately don't have the training to actually be able to deal with this issue appropriately. So there needs to be a lot more training, a lot more services available, and an awareness raising is part of that. Thank you.
Thank you. Councillor Harkin, anybody else on that? Item 12? No. We'll move on to item 13, open for information, and that's DFC People and Place Review. Item 14, the Local Authority Sports Capital Grant Programme Review. Councillor Duffy.
Thank you, Chair, and I appreciate the report. Barry, I'm assuming it was yourself. I think when we look at that report and we look across many of the other council areas and the work that they're doing and the money that they are putting in to provide capital money to our sports clubs, or to their sports clubs, is absolutely fantastic to see. And it's actually a wee bit shameful that we haven't been doing something similar, particularly when we have put it in there as a strategic recommendation that a capital investment programme for sports clubs should be established to recognise sports facility providers as delivering community benefit within their current and future membership. So I think we've already set out the intention to do this, but we just haven't got it across the line, or we haven't added a budget line to it. So I think that coming out of this today, I think that we absolutely need to address that when we look at what other areas are doing and what we could be doing here. So I just want to propose that coming out of that report and that recommendation that's already sitting there, that we include this discussion now through our RITS process, so that we can develop our own sports capital scheme that we can use to support our sports clubs right across the council area. I think it's really important that we do that. So if I could make that as a proposal, Chair, thank you.
And Councillor Boggs has just indicated that he will second that proposal.
Happy to second, Chair.
Thank you, Councillor Duffy. So we'll move on, members, to agenda item 15, and that's the consultation on local authority and district council guidance on grey market foods in the United Kingdom. And Councillor Clark.
Yep, thank you, Aisling. I just want to welcome this. this is actually very important, you know, because it poses quite an issue for those who are living with food intolerances, such as celiacs or those who have nut allergies. All food should be clearly labelled, and a full list of ingredients should be on every label. Because if we know if food is ingested unknowingly, then we can run the risk of anaphylactic shocks, etc., which can and do be fatal. So this is actually very important, and I welcome it. So thank you.
Thank you, Councillor Clark. And we will move on to agenda item 16, and that's the licenses and orders issued under delegated authority. No indicated speakers. 17, dog control prosecutions. No indicated speakers. 18, public consultation on the PHA partnership and engagement strategy. Great. 19, Department for Infrastructure's review of the operation of roads. Okay. 20, correspondence. Anybody want to highlight anything under correspondence or the consultation list?
Can I just ask if the same as kind of we get a scheme of deputations we're waiting to get in, is there any outstanding correspondence we have? I have a couple of things. I don't know if they went through full council or went through here, but it's just whether or not we have anything outstanding that we have sent, like the ambulance service where we have corresponded with them and it hasn't come back. Do we hold a list of what we're waiting on back again?
We have an internal monitoring system, so we table responses as we've received. But if you would want us to include something, you know, that reflects you've made a request at the previous meeting and there's still something outstanding, we're happy to do that. There's no issue. We just included an additional section in that report.
Thank you, Karen. And item 22, child's rights. Councillor McDade.
Thank you, Chair. I just wanted to mention that last week there's been a number of obviously engagement with young people through the UNICEF stuff, and since we've got the accreditation, but a few of us were at one last week in the Waterside Youth Centre, and through the kind of chatting with the young people, they had asked that I request that the Northwest Ministry of Youth could maybe be given an opportunity to come in and provide a deputation to this committee, just to let them, because they were saying it's great to speak to us as elected reps, but I think it's the same elected reps all the time, so they're maybe just feeling that they would love to come in and speak to the kind of broader group as well. So I was just wondering if we could add them to the list. It'd be great. Thank you.
Great, that's grand. Karen, I'll make contact with Claire and the team. Thank you. Can I have a proposer for confidential and a seconder? Thank you. Thank you. That's us in confidential.